Today, I think we all share the same goal, and that is to make sure that our universities and our colleges return to school safely. For me, I know Madam Chairwoman Stewart to have her own remarks. I don't expect this, on my part, to be anything but hearing from the universities and how you plan to um, provide safety for the students and your faculty, and the expectations for students and faculty for a safe return and a safe stay at the public university. So um, the other thought is, I understand it is very difficult because I don't know who knows how to get it right in the city, the state, the country. So I don't have very uh, I'm not going to be very critical in any way. It's just going to be very interesting to hear your plan to return for a safe school year for the students. Um, can't expect more from you than we expect from our from the federal government and our state and cities, because we're all learning still with this pandemic. So it'll be interesting to hear, and I think it'll be good for the state, the parents, the students, and all the taxpayers to know that there is a plan in place for the safety of our public universities. So with that, I turn it right over to Chairwoman Stewart.
Thank you. I think I echo the same. I'm excited to learn of the plans at all the institutions we have across our state. There's a lot of different missions and student body and needs at the different campuses. So I'm really anxious to hear about that. I know people are excited with this prospect of getting back on campus, especially in places where they had not been on campus over the summer or over the last few semesters. In my neighborhood, we have quite a few college attendees, and I've been watching them, load up their vans and start to take them back to campus and doing all the back to school shopping. So I know that people are excited to get on campus, and I know that I trust that we're all planning to do it safely, to protect our students, to protect our faculty, and also to protect our surrounding communities. And so I just look forward to hearing the plans at all the campuses.
Thank you. And it appears that the order of business would be as follows. We'll begin with the Illinois Department of Public Health, followed by the Illinois Board of Higher Education to discuss their COVID-19 guidelines and guidance and recommendations. Then we will move right to the universities. If there are any changes that need to be made for your time slots, we'll do our best to shift it. But right now it's in the order of, at 2:30, it'll be the University of Illinois, followed by Chicago State, Illinois State University, Western Illinois University, Governor State University, Southern Illinois University, Eastern Illinois University, Northeastern Illinois University, and Northern Illinois University. That's the order. And we should start right now with the Illinois Department of Public Health.
Good afternoon, thank you. Chairperson Stewart and Ford, spokespersons Brady and Keisher, and distinguished members of the committee. Thank you for inviting me here today to speak about IDPH's role in the state's guidance for COVID-19 prevention at institutions of higher education. Over the course of the pandemic, IDPH has collaborated with many of our sister agencies to develop and implement evidence-based strategies to prevent transmission of the virus that causes COVID-19. That work has included reviewing guidance with aging, agriculture, children and family services, commerce and economic opportunity, human services, the State Board of Education, and the Board of Higher Education. At each round of updates to the higher education guidance, subject matter experts and senior leadership at IDPH reviewed and consulted to draft guidance that reflected the best available public health knowledge about the virus, agreed with issued guidance for similar settings to the greatest extent possible, and aligned with the most up-to-date federal guidance from the Centers for Disease Control and Prevention. Throughout July, we consulted with the Board of Higher Education on guidance to align with our general guidance for Phase 5. Whenever we consult with others about COVID-19 guidance, we emphasize each of the layers of prevention strategies that we know work to prevent transmission of the virus. First and foremost, vaccination. consistent and correct use of masks or face coverings, physical distancing of at least 6 feet from others, contact tracing, isolation, and quarantine, testing, ventilation, hand hygiene and respiratory etiquette, and cleaning and disinfection. Vaccination, of course, is the leading prevention strategy against COVID-19. The vaccine is widely available across the state, and all persons over the age of 12 are currently eligible. It's also important to note that we're seeing continued and increasing transmission, hospitalizations, and ultimately preventable deaths among people who are not fully vaccinated against COVID-19, which we largely attribute to the highly contagious Delta variant. Based on those factors, we consulted with the Board of Higher Education about strongly encouraging institutions of higher education to require all teachers, staff, and students to be vaccinated against COVID-19. We also discussed appropriate exemptions from any vaccination requirement based on guidance from the Federal Equal Employment Opportunity Commission, which includes medical and religious reasons. Other primary issues for higher education were physical distancing and masking. In both cases, IDPH consulted with the Board of Higher Education to incorporate the CDC guidance that people who are not fully vaccinated and those who might need to take extra precautions, like people who are immunocompromised, wear a mask and maintain physical distancing while indoors, and that institutions allow for physical distancing to the greatest extent possible, given the space in their facilities. As you know, CDC most recently updated their guidance for institutions of higher education on July 27th to account for their new recommendations that fully vaccinated people in COVID-19 hotspots wear a mask in public indoor settings to prevent possibly spreading the virus to others. As we had done previously, we consulted with the Board of Higher Education about the new CDC guidance. The IDPH, we adopted that guidance for the state for phase 5, and we support that guidance for institutions of higher education as stated in the IBHE guidance. Thank you all very much for this opportunity to speak with you. I'm happy to answer questions if you have them.
It looks like Representative Mizaki with a question.
Thank you, Chairman. Dr. Ezike cited a lot of statistics and documents that she stated were the basis for IDPH's position. Are you going to share those with the legislators, the actual underlying documents and data that she's relying on, or that IDPH is relying on?
Thank you for that question. Yes, ma'am. I don't have that information directly in front of me, but I'd be happy to follow up with you after this hearing. So
don't follow up. I want you to just commit you're going to share it with all of the legislators who are on this committee.
I can follow up with the committee to talk about this information.
Right, because I've had difficulty getting information out of IDPH. So Dr. Ezike makes a lot of these pronouncements, but then she won't back it up with the actual evidence that she's relying on. I want to see the actual evidence that she's relying on. Second, when it comes, we obviously, there's been some discussion. I think there was a report out of Johns Hopkins the other day that indicated that people who have natural immunity might actually be lower when it comes to transmitting relative to individuals who are vaccinated. So, what are you doing to account for the individuals who have acquired natural immunity? Because, and this is going to be relevant for some of our later colleges, because many individuals have already gone through COVID, they've developed natural immunity. So what guidance is IDPH doing for that?
In many of our guidance documents, where we have information about fully vaccinated people, we also include people who have had lab confirmed COVID-19 in the last 90 days. So we do try to address and account for people who have natural immunity based on having had previously COVID-19 in our guidance.
Why are you only focusing on the last 90 days?
That's the guidance from the CDC. Well,
okay, but have you done any, what's the rationale though for why some, by that logic, are you going to apply the same standard to anybody who is vaccinated? That they don't count after, that it doesn't count after 90 days?
Well, as I understand the science from the CDC, the immunity from the vaccine lasts longer than natural immunity from having previously had COVID-19.
And I'd like to know what evidence you're relying on for that, because some of the scientific data that I've seen would argue just the opposite, that people who have cultivated natural immunity may actually have a better ability to either have low viral loads or to avoid transmissibility. So I'd like to know exactly what it is that IDPH is relying on to make that assertion. But then that still gets back to the other point, is that so if somebody was vaccinated, more than 90 days ago, is the position of IDPH going to be that there's going to be a point in time where you're going to treat the vaccinated as if they were effectively unvaccinated?
I could get back to you on the answer about the underlying data for the 90 days. Like I said, that is the CDC guidance, but I can certainly follow up about that information and get back to you on it.
Right. Well, is IDPH independently looking at any of this data, or are you just punting over to the CDC?
We do review the data as well, and our team of epidemiologists also give us information on what's happening across our state. So we do review data ourselves internally, but we also do support and rely on the information that's coming out of the CDC.
All right. How many epidemiologists at IDPH are independently looking at and assessing this data?
I'd have to get back to you on that. I'm sorry. I don't know.
Do you know if it's more than 2?
I know at least 2 epidemiologists, but I don't know every epidemiologist at the department. I'm sorry.
Okay. Well, no, but I mean, who are responsible for this and who are actually taking a look at the underlying data?
Yes, we do have a data intel team in the department who provides this information for epidemiologists.
All right. Can you share the names of all the people who are on your data team again with all the members of these 2 committees?
Thank you for that information, certainly.
All right, thank you. And then, one of the other things that I'm concerned about is that we know that at the start of the COVID outbreak, certainly people from particular communities were more likely to be testing positive, and therefore they're more likely to have cultivated natural immunity. So I'm somewhat concerned if you're going to start suggesting that you're going to treat natural immunity differently if you don't have that backed up by actual real world scientific data, because if you are, you're to a certain extent, you're going to wind up creating a de facto racial disparity in terms of how people are being treated. So I'm very concerned about that particular fact. And, I don't want us to be in a position where we're effectively punishing people through what is going to break down into potential racial classifications, which I'm sure you can understand. All right, thank you, Chairman.
Thank you so very much. We could move now to the Illinois Board of Higher Education if no other members have questions for the department. Let me see. I don't see anyone else. Representative Chairman Stewart, anyone in your committee have questions for?
Sorry, I couldn't get my mouse to respond. I'm not seeing anybody. Nobody's indicating to me a request to speak.
Right. So you ready to move to the Illinois Board of Higher Ed? All right.
Yeah, let's hear from them.
All right. See, Jamie is here.
And thank you. This is Ginger Ostro. I'm also here, available.
There you go, Ginger. How you doing?
Great,
right.
thank you.
Who's going?
I'll be happy to start.
Okay, thank you, Ginger.
Great, thank you very much. Thank you for the opportunity to provide an overview on the guidance that IBHE has issued in response to the pandemic. I'm Ginger Ostro, Executive Director of the Board of Higher Education. As Aaron mentioned, our first principle has been to ensure health and safety as students are on campus. And so we have been following public health guidelines in all of our work to date. And let me just take you back to some of the beginning guidance that we issued. Last summer in 2020, we convened what we call the Fall Opening Committee. It was composed of over 20 institution leaders, faculty, and other experts in public universities, private universities, and community colleges, along with public health experts. They all came together to develop guidance. That guidance focused primarily, at the time we were in, I think, phase 3, on phases 3 and 4 of Restore Illinois, and drew on the expertise of all of those folks that we brought together. That initial guidance was released in June of 2020, so a year ago, and then updated in July of 2020. Since that time, I know you all are aware that the University of Illinois developed the saliva test, which was made available to all public universities through funding from the Illinois Department of Public Health. Funding from the Governor's Emergency Education Relief Fund was provided for higher education, and the IBHE distributed those dollars using an equity-based formula to help institutions attract and retain students who were otherwise at risk because of COVID of not staying on their post-secondary track. So low-income students, students of color, first-generation students. We also partnered with other agencies to create a Wi-Fi hotspot map to help people locate publicly available Wi-Fi spots across the state. And we created a Spanish language version of that site as well. Both are still available and actively used on our website, and we get about 20 hits a day of people using them to find Wi-Fi locations they can use. As Illinois entered phase 5, IBHE again worked with IDPH to provide guidance on what phase 5 would mean for higher education. Our phase 5 guidance was issued on July 19th, just a few weeks ago. In it, we focused on we strongly encouraged all public and private universities to require vaccines to protect campus populations and to slow the COVID-19 spread in surrounding communities. Institutions of higher education were strongly encouraged to provide information to promote vaccine trust and confidence and to address vaccine hesitancy. And we specifically noted that at that time, unvaccinated persons and those who might need to take extra precautions should wear a face covering and where feasible, maintain social distance while indoors. That was consistent with CDC and IDPH guidance at that time. New guidance from CDC and IDPH as of July 27th recommends masking indoors for all persons, whether vaccinated or unvaccinated, in areas of substantial or high transmission as identified by CDC. IBHE has just released, as of today, our updated guidance that reflects that new information from CDC. We know that all of the institutions continue to be nimble, to adapt to these changing conditions and circumstances, and to reflect what their individual institutions needs. Thank you for the opportunity to share this overview, and happy to answer any questions.
No questions. Any questions from members? I know minority spokesperson Kiker plans to open up with the higher ed questions there. Oh, I see Mazaki.
Yeah, I have a similar set of questions. Again, your guidance is talking about you want to encourage people to be vaccinated. But again, we know that many students, and we know because the colleges were monitoring them, have tested positive for COVID, and some of them had symptoms. They were quarantined. So again, these are students who have developed natural immunity. So, why are you not including provisions, again, for people who have natural immunity and recognizing that, they're not in any different type of status than people who've already gotten vaccinated and had their immune systems primed to be ready to see COVID?
Yeah, our recommendations are based on IDPH and the CDC guidance, and our recommendations for the institutions of higher education. So it's really taking that guidance and saying what's available, what we encourage the universities to follow.
Okay, so you haven't independently had anyone assess the data or transmissibility results or anything along those lines? You're just relying on CDC and IDPH.
Correct. We are not a public health expert. We do not have public health expertise, and so we are relying on the experts.
Okay, well, have you gone to any outside experts or only just individuals from the IDPH and CDC?
We have worked with IDPH around the guidance that we have issued.
Okay. Right, so nobody no independent experts or anything along those lines.
Right, we have followed what the CDC has recommended and working with IDPH, our experts for the state.
Right, I mean, the problem is, I'm not aware of any clinical studies that have demonstrated you're going to get clinically better outcomes by vaccinating somebody who's already been subjected to COVID and had natural immunity. So, that's why I'm just concerned again that by just sort of saying blanket, you have to be vaccinated or else. That's that to me is somewhat discouraging, not only for individuals who already did suffer through a COVID infection and who likewise should have, natural immunity, but again, it just seems like this is a very blanket sort of statement without recognizing that there's a lot of nuance when it comes to particular individuals. So I'm a bit disconcerted that at the very least, those types of things haven't been taken into account. Furthermore, when it comes to individuals, what is going to be the benefit for individuals to get vaccinated if they're still going to be subjected to a lot of all of these terms and conditions that people were already, people were chafing under them before, but now if you're taking away some of the, if there's no day-to-day advantage that students are going to be perceiving for getting vaccinated, how do you think you're going to manage to get those vaccine numbers up? I mean, if everyone still has to wear a mask, they still have to social distance, they still, where's the upside then to getting vaccinated? How are you going to be able to implement trying to get anything done in what you're referring to as your vaccine hesitant communities if there's no benefit to getting vaccinated?
I think, again, focusing on vaccination as the primary way to minimize transmission and risk of people getting sick is the underlying reason to have vaccination. I welcome my colleague from public health to add in further, but certainly that is the underlying reason to get vaccinated.
Right. Well, but I mean, let's be clear, the current emergency use labels for all of the vaccines, they fully recognize that even individuals who are vaccinated were still catching COVID, right? So it sounds like you're kind of coming at this from the perspective of if you're vaccinated, then that becomes a panacea for transmission, and it clearly won't be, right? I mean, people are still going to become infected with COVID, whether they've been vaccinated or not. It's just a question of, right now, the data is showing that it's going to lessen the risk of hospitalization, lessen the severity of symptoms. But even the clinical data that's been reported is demonstrating that vaccinated people are still, they're still catching COVID, testing positive and experiencing symptoms, albeit at a reduced rate. And if public health wants to jump in on that, that's fine. Doesn't look like he wants to save you.
Yeah, I don't know. Did you hear the question?
I did. Yeah, I mean, there are breakthrough infections that is happening, but over the denominator, right, the number of people who have been vaccinated and the breakthrough infections, it's a very small number, right? We know the vaccine is highly effective, but it's not 100% effective. So there will be some cases among people who are fully vaccinated, but it'll be a relatively small number.
Well, how are you defining relatively small? Because I'm looking at like the Moderna data. So in terms of infections, people who are vaccinated in the patient populations they were studying, 116 had breakthrough tested positive for COVID. 348 did not. It looks like for the Johnson & Johnson one, they had roughly I think they had a 66 versus 193. So, I'm just trying to understand what is behind a lot of the, logic behind this. And I'm also very, you're not communicating effectively exactly what the vaccines are and aren't doing. But, and again, I'm not disputing that there are patient populations where vaccines have absolutely had a better effect in terms of reducing disease and severity and all the rest of it. But, we're talking about college students and we're talking, and it just seems like maybe the better way to get at it is what exactly is your goal when it comes to what you're trying to achieve? Because a lot of the things that you're doing seem to be working at cross purposes. If your goal is to get everybody vaccinated, you should be giving more benefits to students who are vaccinated. If your goal is to, reduce transmissions, I'm not sure that some of the things that you're proposing you might be giving people a false sense of security that you're reducing transmissibility.
Yeah. And you know what? I think that we we about 1 minute before we got to get on schedule. We need to add Representative Smith, Vice Chair Smith, and Burke to the roll.
And can we recognize Representative Scheer? She also has a question. Thank you.
Let me make sure, Ms. Zaki, have you given your final request to the department so that they
and I think if the department can actually, give a little bit more of their input as to exactly what they consider to be their public health goals, because, COVID-19 is now endemic, in the population, right? So what is it exactly that they're trying to achieve with these, with all of these particular things that they're listing here?
All right. So I think that we all would like to know the answers to that. So hopefully that's what you guys could get us the answers to both committees.
And relatedly, why are you not separately accounting for immunity considerations associated with individuals who have already experienced COVID naturally? Because if in fact, with the vaccine theory works, and basic immunological theory works, is that both classes of individuals, vaccinated and people who have gone through COVID, should have their immune systems primed to recognize the COVID virus and handle it accordingly. So I'm concerned that you haven't separately considered that, because you're going to raise the risk of additional liability and risks for individuals and potential litigation as well.
Thank you so much.
Thank you, Mr. Chair. I just wanted to make sure I was able to ask my one quick question before we move on.
Go ahead. You've been recognized.
Okay, thank you. I just had a question. They mentioned that there was a website for the hotspots availability. Do you have that, or do you want to get that to us later, or?
Yes, thank you. It is available. It's linked from the IBHE website, but I will be happy to follow up and get everybody the direct link to it as well. But if anyone would like to go to ibhe.org, you'll be able to find it right from one of our landing pages right there on the front.
Okay, I thank you and appreciate all your efforts. This isn't easy. Thank you very much.
Thank you.
I think we're ready now. We're just 2 minutes behind, but that's good. We'll go right to the Systems University of Illinois for their presentation.
Hi, our Dr. Go should be on somewhere on here. Oh. Vijit, are you there? I see you. I think he's trying to figure out the mute.
Want to go to Chicago State and come back? Is he?
Yeah, go ahead. I think they're figuring it out.
All right. President Z. Scott.
Good afternoon. We are here. This is Z. Scott, President of Chicago State. I'm joined this afternoon by our CFO, Craig Deach, and our interim Vice President, VP of Legal Affairs and interim General Counsel, Walter Pryor. Good afternoon, Chairman Ford, Vice Chairman Smith, Representative Keecher, Chairwoman Stewart, Vice Chairman West, Representative Brady, and members of the Higher Education Committee and the Higher Education Appropriations Committee. Thank you for convening this important hearing. It is our view that we must work together to address and understand the status of our Illinois public higher education institutions as we proceed into a new academic year. We all know that before the COVID-19 pandemic began, Illinois was already in a crisis with regard to its Black students. According to the data that has been represented by the Illinois Board of Higher Education, the Black student enrollment in our Illinois colleges had plummeted by 34% between 2013 and 2019. And the data signals that the enrollment is further dropping for our Illinois Black students and low-income students. This outsized impact of the pandemic has required Chicago State University to rethink and revise our operations and how we offer education services and how our students engage and experience with Chicago State University. As an Illinois public institution and an Illinois public institution serving one of the highest number of low-income students of any institution in the state, we have taken a very close look at our students' needs, and I'm proud to say that we have remained responsive and adaptive to what we've heard. To encourage students to keep learning, we have engaged in several strategies through the pandemic. We have implemented a new debt relief program for categories of juniors and senior students, at which Chicago State is offering close to $500,000 in debt relief to students who are students who have stopped out during the pandemic who are eligible to return. We have done tireless outreach to our neighborhood high schools and other community institutions, and we have added scholarship opportunities and more to the category of supports that we have offered our students. Across the board, Chicago State remains vibrant, open, and a safe institution of higher learning. Chicago State is doing everything we can to support our students and staying the course, but we cannot do it alone. That is why we are pleased to see the engagement of our Illinois General Assembly. I want to pause and offer some data points that are important for you to understand about Chicago State. As you know, Chicago State is Illinois' only United States Department of Education predominantly Black institution. 78% of our students are African American or Latinx, and over 61% of our students are first-generation degree-seeking students. According to the data of IBHE, 1 in 10 African Americans with a degree in Illinois earned that degree from Chicago State. 91% of our students are Illinois residents. Most of our students are coming from communities that have been and continue to be hardest hit by COVID-19 and its impact on income, jobs, and health disparities. We are mindful of these statistics and the need for Chicago State to not only serve as an institution of higher education, but also as a community anchor to support our state through these challenging times. The health crisis that we are in is already creating economic hardship and has revealed great economic and social disparities and inequalities in our state. We continue to need the state's assistance to provide access to degree completion for Black and Brown students. Over the last year, Chicago State's faculty and staff have worked alongside of me to develop policies and procedures for our safe return to campus beginning this fall. As we continue to focus on providing our students with a high quality education and co-curricular experience, we are committed to following current guidance and recommendations by local, state, and national public health officials to safeguard our campus's health and safety. Our work continues to be guided by a group of shared guiding principles, which serve as our framework to preserve the interest of our students, faculty, and staff, and help guide the development of Chicago State's operational decisions. At all times, our number one priority has been to ensure the health and safety of our students, faculty, and staff in the communities that we serve, and while remaining true to our vision, mission, and values. As we continue to look to the future, we have collectively agreed on our set of values that we share with you today. In spring 2020, I convened a cross-campus group of stakeholders to develop our fall 2020 operating plan. In that plan, we had prioritized health and safety. Our fall committee met regularly and presented recommendations ranging from course delivery to student service that laid the foundation for our path forward. In addition, we created a campus COVID-19 response team consisting of 22 faculty members and administrators, which continues to meet weekly to review our campus and neighborhood case rates and testing levels, to look for new health guidance, and to evaluate any needed updates to our operating plan. Our cross-campus group reconvened in fall of 2020 and spring of 21 to make recommendations to develop our spring 2021 operating plan and our current 21-22 academic year operating plan. Our current academic operating plan provides an overview of important requirements, guidance, and expectations as we move forward to resuming all in-person operations. The plan highlights several student support services available to our students, including academic assistance and mental health resources such as counseling services. It outlines several ongoing physical upgrades that have been made to campus. In addition, we have implemented an additional, as I talked about, student debt relief program. Our priorities as we focus on health and safety led to the creation of our campus dashboard, which houses weekly data for our campus and surrounding community. The dashboard remains live and can be found on the COVID-19 section of our website. We've also implemented a new safety-focused symptom self-check app entitled Cover, which allows CSU community members to self-monitor and report daily before coming to campus. With regard to our shared living accommodations, our residence hall occupancy will be based on current health and safety guidance from CDC and IDPH. All students living in the residence hall must be fully vaccinated and complete training on maintaining clean spaces and safe social distancing practices. Students are also required to participate in mandatory surveillance testing. Periodic surveillance testing is required for all vaccinated individuals and twice weekly testing for exempted individuals. We have designated isolation units in our dorm in the case that they may become necessary. Visitors will be restricted in our residence hall. We have partnered with a federally qualified health center, a community hospital, and a retail pharmacy to provide campus COVID-19 testing for our campus community, and also to provide vaccination pop-ups. Vaccinated and exempted individuals will be required to test weekly. In addition, we partnered with the Chicago Department of Health, establishing a mass vaccination site for the entire greater South Side of Chicago. Our university policies will continue to conform to current CDC and IDPH guidelines. According to our policy that was issued yesterday, all faculty and staff are required to be fully vaccinated. In addition, all students residing in the residence hall and student athletes are required to be fully vaccinated. All students, faculty, and staff and visitors must wear a face covering in university space indoors, regardless of vaccination status. Throughout the pandemic, regardless of vaccination status, we have endeavored to maintain a robust education and world-class instruction for our students. I am honored to have been asked this past spring by Mayor Lightfoot to serve on the City of Chicago's COVID-19 Recovery Task Force. This honor was extended to me again as I was asked to serve on the statewide Higher Education Reopening Committee facilitated by the Illinois Board of Higher Education. In the summer of 2020, Chicago State hosted the Rebuilding Chicago Small Business virtual conference to help support our small businesses in rebuilding through the pandemic. And as we highlight our community support, in response to the emergence of devastating data, which revealed the disproportional negative impact of COVID-19 on Black and Brown communities, the university hosted a health and wellness forum entitled Protecting Our Communities from COVID-19, Separating Fact and Fiction and Strategies for Staying Healthy. As I said, we remain committed to our mission of providing a safe, world-class educational environment for our students and community. To assist our work, the Chicago State University has received funding through the Federal CARES Act, which directly supports students and specific institutional needs related to COVID-19. Our CFO, Craig Deach, will provide you with information regarding how our CARES Act funding was spent during the pandemic and how the significant impact of the pandemic has and continues to have on our campus. So I'll now turn it over to Craig Deach, And I want to thank you for your time.
Thank you. Madam President, are you going to remain, because I know the minority spokesperson said he had a question for you. Are you going to remain at the?
Yes, I'm going to remain.
You're hosting a brain.
I'm going to stay.
Thank you. So please proceed, sir.
Good afternoon. My name is Craig Deach. And as the president said, I am the CFO and Vice President of Financial Operations at Chicago State University. It is my pleasure to speak to you today. The financial impact of the pandemic on Chicago State, like most institutions of higher ed, has been significant. What is unique to our university is the amount of financial burden carried by the student population we serve, a burden of which was only exacerbated by the global pandemic. Going into 2020, over 50% of our students lived at or below the poverty line, over 50%, resulting in many students facing housing and food insecurity. We know that the pandemic further stressed our vulnerable student population. This point is highlighted in the recent report by the Department of Education called The Desperate Impacts of COVID-19 on American Students. In order to enable as many students as possible to stay the course, we work diligently to prioritize student success and their health during this challenging time. In short, due to the pandemic's impact on some of Illinois' most vulnerable student populations, the net negative financial impact on Chicago State, after accounting for stimulus funding revenue, is almost $8 million, which for us is a considerable hit to our cash flow. After increasing our enrollment going into fall of 2019, from fall of 2019 to fall of 2020, Chicago State experienced a 3% increase in graduate enrollment, but a 20% decline in undergraduate enrollment. With the disparate impact of the pandemic on our population, we have not seen a return to the fall 2019 numbers as we look at fall 2021 enrollment. The result is a projected $10 million decline in revenue from March 2020 through the end of the academic year 21-22. We also project to incur $5 million in pandemic-related expenses, PPE, safety and security, classroom and lecture hall upgrades to allow hybrid learning, laptops and remote working software for employees and students, air filtration, et cetera. This is a total of $15 million in revenue loss and new expenses. To date, Chicago State has received $16 million in CARES funding. Approximately half of the $16 million will go directly to students or student success items such as laptops and internet access. And the fact that Chicago State needs to provide internet access to our students only highlights the digital divide that still exists for these students. 3,000 students have already received emergency funding, and more students will receive emergency funding this fall. Additional funding will go directly to student debt relief. The other half of the funding will cover the loss in revenue and projected critical areas of need for campus operations, particularly technology upgrades to support remote instruction and infrastructure upgrades, including to our ventilation system so that Chicago State can align with public health guidance. And this is how we arrive at an $8 million net negative impact. For a campus with a $62 million appropriated budget and small cash reserves, this is significant and impactful. We are grateful for the stable funding received to date. However, with the reality of the pandemic's impact on our students, the one-time stimulus funds are not sufficient to cover our losses and to provide what many of our students need to access college or continue their studies successfully. Thank you very much for your time today.
Thank you. Representative Kiker.
Thank you very much. And Mr. Deutsch, if you could bear with me here, I have a couple questions for you. First, you mentioned a $62 million appropriation. What's the total budget of the institution?
So, am I okay? Yeah, sorry about that. But 90 million if you take into account auxiliaries and grants, et cetera.
Okay. Can you tell me the percentage drop in the student? You said it hadn't recovered back to the fall 2019 numbers. Tell me where it's at today as a percent.
We are about flat with where we were in 2020. So if you go back, we're about flat where we were last year.
Okay, so in your comments, you had talked about you haven't recovered to the 2019 numbers. What is that deficit, please?
Oh, it is approximately
of student enrollment, the deficit of student enrollment, not dollars.
13% drop in total head count.
Okay, so it was 13% from 2019 to 2020, and it has stayed flat, -13, as 2019 being a baseline.
Correct.
Okay. And can you please share with me the percentage of your staff today that is fully vaccinated?
As of today, we do not know. We have not yet began requiring the receipt of the vaccination data. We will start that shortly, but we do not know that yet.
What's the first day of classes?
August 23rd.
Okay. And so you're going to have that information. You're going to be comfortable. You're going to be able to cover classes within that few weeks' time, finding out that vaccination, because I heard the comments that we will make sure 100% of our faculty is vaccinated on campus.
It is a process. So we are starting the process. We realize that it's going to take a little bit of time to get fully implemented. But the requirement will be that everybody is vaccinated. We realize it is going to be a process to get there. It is something that we just announced to the campus recently.
Okay, do you have a framework in place that you're going to deploy, or you're still trying to work on the framework to gather that data?
We do have a framework in place.
Okay, thank you.
Yep.
Thank you, Representative Kiker. Do we have any more members seeking recognition from appropriations higher ed? I don't see anyone. Representative Katie Stewart, do you have anyone?
No, I haven't had anyone request to be recognized.
All right. So we could go back to the University of Illinois.
Thank you, Mr. Chairman.
Oh, there you go.
Okay, thank you.
Thank you.
And to Chairperson Stewart, deeply appreciate your longstanding work on behalf of the higher education and your appreciation for the good that higher education does for Illinois. My name is Ravijit Ghosh. I'm the Executive Vice President of the University of Illinois System. And I also want to thank Representative Kiker and Representative Dan Brady and other members of this committee for their commitment over the years to help advance higher education in our state. Thank you for this opportunity to speak to you today about how the three universities of the University of Illinois System are preparing to begin the fall semester. The COVID-19 pandemic has presented challenges to society that few of us could have imagined, and higher education is no exception. At the University of Illinois System, we're very proud of the steps we took throughout the course of the pandemic at all three of our universities to continue our core mission of educating more than 90,000 students enrolled in Chicago, Urbana-Champaign, and Springfield, and also conducting groundbreaking research that provides economic and societal advances for Illinois and its people, and has also helped us keep them safe during the pandemic. All through the past 16 months, our focus has been to protect the health and safety of our students, faculty and staff, and the communities in which we are located. But after a year of hybrid education, our students are yearning for a return to more traditional in-person instruction in the fall. So we are working hard to plan the safest possible return to primarily in-person learning, always keeping in mind guidance from state and local health officials, as well as following the guidance of the U.S. Centers for Disease Control. We have limited in-person classes following these, limited large in-person classes following these guidelines. Vaccinations against the virus is probably the most important tool we now have to ensure the safety of our returning students, faculty, and staff. All three universities will require that those who are able to do so be fully vaccinated on campus. We recognize that some people, due to their health conditions or for other reasons, may not be able to be vaccinated. For those individuals, testing through Shield saliva-based test and trace program developed at Urbana-Champaign will continue to be required. The robust testing, and we're also offering online courses for those who for any reason feel uncomfortable to being in the campus physically. The robust testing and contact tracing that SHIELD program provided have been the key to safe operations at our universities throughout the pandemic, as well as in many other campuses and schools around the state and beyond. Of course, consistent with the CDC and public health guidance, all students, faculty, staff, and visitors will be required to wear face coverings in all indoor spaces, regardless of vaccination status. For so many students, living on campus is a major piece of the college experience. This is reflected by the strong demand for space in on-campus housing at our universities. Housing departments at each campus have developed plans to safely welcome students for the coming fall. We are opening dorms and other on-campus living spaces for almost normal operations. Housing employees at each university will continue the rigorous sanitization process used over the past year to clean public spaces and other high-traffic touchpoints. And space will be set aside for isolation and quarantine for those dorm residents who have been exposed to someone with the virus. As we have learned through the many months of the pandemic, however, circumstances can change, of course, and we will continue to consult with the state and local health officials and closely monitor all guidance and to continue to follow the modeling of our own researchers, which has helped us throughout this past 16 months. We'll follow the science, and as we have throughout the pandemic, pivot if needed. This could include expanding testing requirements to resemble our approach over the past year, or taking other mitigation steps necessary if deemed so. I should let you know that students are responding positively to our plans. Although it is still too early to confirm, indications are that we'll have another year of robust enrollment this fall. When the 10-day enrollment numbers come out later this fall, we may see another record enrollment. If true, that would mark an all-time high for the state year system-wide. It is also important for me to note that with the hardships created by the pandemic in mind, our Board of Trustees voted to freeze tuition for the academic year that is about to begin. The system has now frozen tuition in 6 of the past 7 years. This is our commitment to the affordability of our students. We have also continued to give high priority to financial aid. Institutional aid now stands at roughly $258 million a year. All these measures are part of our commitment to accessibility and affordability and essential to our effort to continue to provide educational and economic opportunities even during this unprecedented circumstances. As we all know, fighting the pandemic has been a costly affair. Through April 30th, the UI system, including its 3 universities, had incurred $382.7 million in unbudgeted costs and lost revenues due to the pandemic. That figure does not include the cost of the University of Illinois Hospital, a key piece of Chicago's frontline defense against COVID-19. We are grateful for the federal stimulus funds and the state's help that has helped offset some of these losses. Of the approximately $380 million of costs and lost revenue, about $180 million will be offset by the funds from the 3 federal programs. Bulk of the federal funds, of course, went directly to students in helping them through various forms. But some of it did help us cover some of our extensive costs on testing on our campuses for the past year. It also allowed system universities to recoup some of the money refunded to students for housing, dining, and other services that students could not use, as well as the cost we incurred ramping up online courses last year and other expenses incurred to keep people safe during the pandemic. We also incurred considerable costs in helping our students get access to remote learning by providing computers, Wi-Fi hotspots, and other necessary equipment. But even with this federal help, the system's pandemic-related losses through the end of April stood at over $200 million. And this number continues to grow as we continue our mitigation efforts to keep our communities safe. Continued state and federal support of our mission and appreciation for what we have provided to Illinois and its citizens, particularly now, as we navigate this dangerous pandemic, is vital. Our partnership with you has never been more important. I hope you'll consider the challenges higher education continues to face as you consider the budget for the coming year. I have mentioned the SHIELD program several times throughout the course of my remarks. It is a great illustration of what EFI system and our universities can do to help the citizens of the state. Scientists at Urbana-Champaign quickly developed SHIELD at the onset of the pandemic as a simple, cost-effective way to reopen our universities. Along with the test, we set up an app-based system to inform individuals of test results. All the students, faculty, and staff who were on campus over the past year were tested twice a week. The simple, reliable test provided fast results and is the reason that our positivity rate have remained well below 1% throughout the pandemic. Our campuses have been among the safest places in the entire state. In partnership with the state and Department of Public Health in particular, SHIELD has now been made available to all other Illinois public universities, community colleges, and K-12 schools across the state. Several businesses critical to the Illinois economy are using SHIELD, as well as the legislators and the federal court system. As of now, SHIELD is active in over 700 sites across the state, and the number is still growing. Our hospital system in Chicago has been at the forefront of fighting COVID, not only at the main hospitals, but also at the clinics across the city. And when vaccines became available, it mounted a systematic effort to make that available to the entire public. And our efforts to protect the state go beyond SHIELD and the hospital. Just as one example, our Discovery Partners Institute, in conjunction with researchers from Chicago and Urbana-Champaign, are working with the Illinois Department of Public Health on a project to monitor wastewater for the presence of COVID virus to quickly identify potential outbreaks. This effort will eventually extend to all 102 counties in Illinois. We are proud of our efforts throughout the pandemic to teach and research, but also to help the state navigate the crisis and stimulate the recovery. And on behalf of all my colleagues, I can assure you that these efforts are not going to cease. Thank you again for the opportunity to discuss our plans with you. Be happy to answer any questions.
Thank you. Moving right to questions from Representative Mazzocchi.
Thank you, Chairman. Dr. Go, thank you very much for being here. But first of all, I do want to dispel the notion that all of your students are responding favorably to your plans, because I've actually had several students who are University of Illinois students reach out to my office very concerned about the vaccine mandate that you're planning on imposing on them. Again, particularly for students who actually caught COVID at the University of Illinois, tested positive according to your SHIELD system. University of Illinois forced them to quarantine for 14 days, including after the time period when they were experiencing symptoms. And they're very, when they consult with their medical providers, they're being told that it's not medically indicated for them to get vaccinated. Yet you're essentially telling them that the condition of coming back on campus is that they have to have a vaccine that would go against their existing doctor's medical advice. So, aren't you concerned that, again, you're not creating any type of subset or, making any accommodations for students who your own university said, sorry, you're COVID positive. According to our test system, you've had symptoms. We're going to force you to isolate, but now we're going to have you take a vaccine your own doctor wouldn't recommend. Aren't you concerned that your protocol is forcing students into, what I would consider to be a pretty impossible situation?
Well, first of all, I thank you for your question, but I did hear the response from the previous speakers about that. That is, this is the guidance that has been provided by public health officials. I'm not a virologist myself, but so I can't, you ask questions about the clinical data. I can't provide you that because I don't study that. But what we have been trying to do is to follow the guidelines set by public health officials as well as the CDC. And I believe the rationale there is that the vaccination provides a range of immunity that might not be available from somebody who got mild symptoms before or otherwise. So, but as I said, I'm not a virologist, so I can't argue with that with you. But I believe that what we're doing is following what the scientific and the public health officials are asking us to do. And that's what we are doing. When I said the students are responding, what I was referring to is the numbers of what we are seeing is the expected enrollment trends that are going to happen in the fall.
Right. Well, again, the University of Illinois doesn't exactly have a deficit of people who have expertise in this type of area. Have they done any? Maybe I could put it this way. Is this something that your own internal experts would have recommended? If
our internal experts definitely recommend vaccination.
Right, including for individuals who have already gone through COVID experience symptoms and developed immunity.
As you heard before, the typical guidance is if you've had COVID within the last 90 days, then you're asking people to wait. But if it's longer than that, then they're asking to vaccinate.
Right, but even if you look at the data in the emergency, the ELAs for all of the different vaccines, very few of them actually tested for any type of efficacy past 28 days. So what's the rationale for saying we're going to have this 90-day cutoff when even the clinical data that's currently before the FDA and the emergency license documents don't even go past 28 days? And even there, there's obviously evidence of breakthrough infections and the like.
I have not studied that data, so I can't really tell you that. But all I can tell you is the guidance that we have been provided both by our internal experts as well as the public health groups across the nation.
Well, who is your internal expert point person that you're relying on for this?
We have a number of them who have been doing these studies, but they are also working with the local public health departments and trying to understand what they're doing. So it's really the public health departments that are providing the guidance. And as you heard, both from the IBHE and others, we have been asked to follow those guidance. And I think that's the right thing for us to do.
Okay. Just out of curiosity, have you been warned either by insurance carriers or anything along those lines, whether they're going to refuse to provide coverage if in fact you don't comply with the IDPH or CDC guidelines?
I'm not aware. I can't tell you about that. No.
Okay. Is there any liability risk for you to develop your own program and protocol based on your own independent scientific judgment?
Well, the liability risk is not following public health guidance.
Right. That's my point. All right. Thank you very much, Chairman.
Thank you. Representative Stewart, any? Okay, we're going to go right to Leader Brady to introduce our next witness. Thank you so very much, University of Illinois.
Thank you very much, Mr. Chairman. Can you hear me all right?
Yep.
Okay, thank you very much. It's my pleasure to introduce the 20th president of Illinois State University and the first female president. of Illinois State University, President Kinsey, who joins us today with others. She assumed her duties July 31st of this year and comes to Illinois State University as the past Vice President for Research and Innovation at Western Michigan University. And she also has a more than 25-year career spanning in higher education. And she previously served as Vice President of Research and Professor in the Department of Biochemistry and Molecular Biology at Rutgers University. So she certainly has a background in the subject matter we're talking about today. And so it's my pleasure to introduce Terry, President Kinsey, to all of you and the House Appropriations, Higher Education Committee, and Higher Education Committee. On Higher Education, we welcome you. Look forward to working with you as you come in to take over for President Dietz, and we wish you the best, and the floor is now yours.
Thank you, Representative and Spokesperson Brady. I appreciate the chance to meet with you last week and your support for higher education in Illinois State University. Good afternoon, everyone. It's my pleasure to be attending my first legislative opportunity to present at a hearing. And I'm also very excited to be at Illinois State University. As again, I want to state that you will notice that we are wearing face masks in accordance with the CDC's most recent recommendation regarding face covering in common indoor spaces. I'd also like to extend my greetings to Chairman Ford and Chairwoman Stewart and all the members of the committee. Joining me in our conference room are members of my leadership team, Andave Tarhuli, our Provost and Vice President for Academic Affairs, Dan Stevens, our Vice President for Finance and Planning, Levester Johnson, our Vice President for Student Affairs, Jonathan Lackland, our Director of State and Government Relations, and Katie Killian, Interim Chief of Staff and Assistant to the President and Co-Chair of the COVID Steering Team at Illinois State University. As we have planned for the fall 2021 return to campus, I want to go on the record that we sincerely appreciate the collaborative nature of our higher education colleagues and the leadership of the Illinois Board of Higher Education and the Illinois Department of Public Health in developing our 2021 fall plans. And it's been extremely helpful to be able to learn from colleagues, and as a result, to gain a new appreciation for the distinct needs and differences and therefore approach to COVID-19 of institutions in various regions of our state. Our efforts are led by our COVID-19 steering team, a cross-divisional team of individuals. They have worked diligently, day and night, with our campus partners to develop a plan for Illinois State University that is built on science and takes seriously the impacts of our decisions. Illinois State announced in late February that we were anticipating and planning for a more traditional campus experience for the 2021-22 academic year, and for the majority of our courses to be held in person. We listened to our students and their families, as well as our faculty and staff, in developing a plan for this year that can safely provide the traditional and holistic campus experience that is a hallmark of Illinois State University. That experience provides, at the very least, orientation and transition programming, individualized attention, and experiential learning opportunities that contribute critically to the personal and professional development of our students. But at the forefront of our planning is our strong commitment to the health and safety of the campus and the larger community, while making extraordinary efforts to provide innovative approaches to teaching, learning, research, and the overall experience of our students. And at this time, approximately 90% of our courses will be in person or hybrid for the fall term. Our residential housing environments are full for the fall 2021 term. However, the number of students living on campus is by design reduced to lessen the density in these buildings. We will have only single or double rooms. We will have extensive cleaning in high traffic areas, both in residence halls as well as across campus. And we have designated on-campus quarantine and isolation for students should they need to remain on campus. But I would say that while COVID has created challenges, there are also many lessons learned that will positively impact the future. For example, providing telehealth services for mental and physical health has been well received by our students. Utilizing technology solutions within classrooms and work environments has provided for a lot of innovation. Student support services such as technology loaner programs and online resources have been instrumental for all of our students. And revising our remote work policy to ensure flexibility for our employees consistent with their responsibilities, will help us now and moving forward. But it is important to note that throughout our planning, we have specifically relied on public health guidance from federal and state agencies and the Governor's Restore Illinois plan. And that guidance has, by necessity, frequently changed throughout the coronavirus pandemic, and we have quickly adapted. Just last week, we updated our fall plans as a result of updated public health guidance and increased information on the Delta variant. Illinois State is now requiring the COVID-19 vaccine for students, faculty, and staff. But even before that, in an effort to encourage vaccination, the university has offered $100,000 in scholarships and significant on-campus dining dollars to encourage students to get vaccination. And we have promoted health literacy for our students to speak with medical experts and get their questions answered. We will have free vaccination clinics for students, faculty, and staff on multiple campus locations, weekly on-campus COVID-19 saliva-based testing developed by Shield Illinois all across campus and required of all students, faculty, and staff, which we will carefully track until vaccination records are received by the university, which are required soon. We sincerely appreciate the collaborative efforts of our colleagues at the University of Illinois as we have implemented this testing program on our campus. Students living on campus must also submit vaccination records prior to move-in or provide a negative PCR COVID-19 test within 72 hours of their scheduled time. And as you can see, face coverings are now required on campus and indoor spaces. I may be stating the obvious when I say that COVID has been extremely challenging. However, I continue to be impressed by the resiliency of our students, their families, faculty, and staff. We also believe that our fall 2021 enrollment numbers are reflective of the support that we have received from students and their families as we move forward with our approach to the fall term. At this time, before classes start, fall enrollment is anticipated to be within 1% of fall 2020 enrollment. While this is a good news, we're also pleased to say that college entrance scores remain strong, and we've actually seen a slight increase in high school GPA. We've also seen enrollment for new graduate, new international, and new transfer students, as well as African American and Hispanic undergraduate students increase slightly over last year. This disparity is important to recognize, and we're pleased to see that that has shown an increase. But the financial impact of COVID-19 is a far less rosy story. ISU's total financial loss and costs incurred to date from COVID-19 is approximately $78 million. As you can imagine, some of the biggest losses are in student housing and dining contract refunds, reduced occupancy levels, and other safety-related costs, as well as student fee refunds. Other major categories included FY20 expenses for COVID testing, personal protective equipment, face covering, cleaning supplies, and medical supplies for our student health services. We invested heavily in instructional IT software and hardware enhancements to support virtual learning and teaching, including computer loaner programs for our students, and many other categories of reduced revenue include athletics, as well as campus and community events. On this last point, I'd like to make it clear that COVID's impact on the university has had a significant ripple effect on the larger Bloomington normal communities as a result of fewer students, faculty, and staff on campus, and revenue impacts on restaurants, hotels, and retail stores, as we've not had these events. Students and families have experienced significant financial and personal hardships. We have hundreds of stories from our students, but I'd like to share words from two. One stated, "At the beginning of COVID, my dad's business was forced to shut down for an extended period of time, doing a lot of damage to our financial situation, and my mom's job was cut because she was not needed due to online school." Another said, "I lost my job because my place of employment closed due to COVID. It is becoming increasingly harder to pay for groceries, rent, and utilities." Like so many organizations, businesses, families, and individuals, Illinois State is extremely grateful for the relief funding provided by the federal government. In stage one, Illinois State received $16 million in CARE Act funding. 100% of the $8 million student portion was distributed as financial aid to over 10,500 students. And the $8 million in institutional support was used to cover just a portion of our housing, dining, and student refunds for spring. HERF 2 was $25 million and HERF 3 is $44 million. Over the summer and spring of 2021, we distributed $8 million in student aid from HERF2 to more than 8,800 students. And the $17 million institutional portion will reimburse the expenses that I mentioned. With HERF3, our funding was $44 million. $22 million of that is now defined for students starting this fall when the students return next Monday in financial aid for fall and again in spring and summer. And the institutional portion again will cover some of our expenses related to technology, lost revenue, enhanced safety, and specifically cleaning as well. So as I mentioned, Illinois is extremely grateful for the relief funding, but that funding does not cover our losses. I circle back to the $78 million number. Our institutional aid adds up to $47 million, which leaves us with $31 million in COVID-related expenses not covered by our grant. In the face of these numbers, I'd like to credit our Board of Trustees for freezing tuition at Illinois State University this fall as yet another way to support our students. And I'd like to end by thanking the committee leadership and the members for taking the time to meet with us and the delegations from other public universities across the state. We appreciate the support of the state and the legislature and what you give to Illinois State and the other public universities. And we look forward to continuing to partner with you as advocates for higher education and all of its value to the citizens of Illinois. And we are happy to answer any questions.
Thank you, President. And you waste no time coming in strong, representing the university. Great job. Thank you so very much.
Thank you.
Representative Stewart.
Yeah, I wanted to welcome you also to Illinois, and thanks for such a strong presence. Also a fellow Scarlet Knight here. So did my undergrad there in New Brunswick. So welcome from the Garden State to here. And I just appreciate you taking the time and diving straight in. Thanks.
Looks like we have two. We have Representative Kiker and Leader Brady.
Awesome. Thank you. And welcome as well as my peers. Trying to keep on time here. Can you share with me, please, Doctor, the percentage of staff that you have that you're aware is vaccinated currently?
Certainly. So we announced the requirement last Wednesday. We are already over 50% reporting of vaccination by faculty and staff, and that is in just barely a week.
50% self-reporting. Have there been any rejections of the opportunity to say, no, yes, I've been vaccinated? Okay. So just thus far, you've only heard from 54%.
50, slightly over 50% have reported in about a week.
Excellent. Thank you.
Thank you. And we have Leader Brady.
Thank you very much, and thank you, President Kinsey and staff. Just quickly, and maybe this goes to Sylvester, but residential life, and I know you talked about single occupancy, but for the double occupancy, is there plans in place, and this really for all the universities, for the inevitable situation where someone won't wear the mask, someone wants them to wear the mask in roommate settings? How are those things going to be dealt with, at least at Illinois State? And it's really something we'll find out from the other universities as well.
Yeah, thank you so much for that question. Just as we've done in the past, our trained staff, whether it's RAs, professional staff within those facilities, address these type of roommate relationship type of issues on a daily basis. So we will start there as far as trying to work things out and try to get the correct behavior. If not, there are things set within our student conduct code which address these type of situations, and we can follow up through our conduct code and Dean of Students Office and follow up on behavior in that sense.
And so obviously it'll be just dealt with on a case-by-case basis if it becomes more severe than that.
Absolutely, case by case, and as you probably already know, all these cases are so different and vary so much, and we need to be sensitive to the different type of backgrounds and circumstances going into these.
Thank you.
Looks like we have Representative Mizaki. Thank you, Leader Brady.
Thank you, Chairman Ford. And this is actually a question I'd like to get input on from all the other universities. If you have teachers who refuse to be vaccinated, are they going to be terminated from employment?
So the initial step is we have a testing protocol for people that are not yet vaccinated. We will work through and discuss with them. Our human resource department will deal with all personnel issues via our standard process for following university regulations.
Right, but are students going to be forced to leave the university if they won't become vaccinated, or but at least for teachers, are you going to say either get vaccinated or you're fired if it gets to that point?
Provost?
They'll be required to get tested. If you are not vaccinated, then you have to follow a testing protocol for a certain number of weekly or whatever frequency we have determined. So no, we're not telling somebody go home. You will have to be tested to make sure that you won't infect other people. And if you become infected, then you quarantine as per previous procedure.
Right. All right. Thank you, Chairman. And I'd like to hear that and answer that question from the other universities as well, if we've got time.
Pose that question so that everyone can hear it, so that they can add it to their.
Sure. The question is essentially, what are going to be the consequences for teachers if they refuse to get vaccinated? So Governor Pritzker, I believe in his press conference, indicated that he wants to have as many people as possible vaccinated. He's trying to, put pressure on people to ensure that they get vaccinated. If you have teachers who refuse to get vaccinated, will be their termination from the university be on the table?
Okay, thank you. More from the university. Not, I want to thank you for your presentation, and we could move right to our next presenter. And that that means that we are now looking for Western Illinois University.
Hello, Chairmans Ford, Stewart, Vice Chairman Nix at the Maurice West, Minority Spokesmen Kiker and Brady, and our own state rep Noreen Hammond, and all members of the House Higher Ed and Appropriate Committees. This is Jeanette Malifa. I do Western Illinois University's governmental relations. And we thank you for this opportunity to share our return to campus plans with you this afternoon. It is called Protect the Next, Phase 2. And with me, I have three testifiers. David Braverman, Dr. David Braverman, our new VP of Student Success. Joe Roselieb, our Executive Director of Auxiliary Services and Risk Management. And Shannon Sutton, our Interim VP for Finance and Administration and our CFO. Joe Roselieb is going to briefly go through our Protect the Next plan, which hits on all the subjects you've asked to hit. And then we will be open for any questions. And Shannon will talk about federal funds.
Thank you so much. Please call your presenters.
Joe?
Thanks, Jeanette. Thanks, everybody, for your time today. I'm going to briefly go through what Jeanette indicated, our Protect the Next 2 plan, which plays off of last year. Like our fellow institutions within the state, a lot of this is building off of what we learned last year, and taking it sort of one step further and learning the pros and cons of what we learned from last year. So we will do enhanced cleaning. Our classrooms are going to be at 6 feet. Our residence life, we have, just like the ISU, we have single rooms and double rooms. We are, since that just came up as a question, we are treating rooms as a single family unit. And to answer, I believe, Representative Brady's question, what would happen if we did have a roommate conflict is very similar to ISU's. It sort of falls under the gamut of any other conflict within the residence halls. And so we would work with our RA staff and our residence hall staff that's full-time in the building, work on a case-by-case basis. And we do have space to relocate students if it came to be that. Last year, it was just like a lot of things. You plan for the worst and hope for the best. We thought there was going to be a lot of confliction between mask wearing and a lot of things, and it wasn't that way at all. We had a lot of people that complied with our rules and understood them, And we try to approach that from an educational standpoint when the time is versus running them through a student conduct process or censure of that standpoint. So we will we'll work on them on a case-by-case basis and respond accordingly. But again, we do have space that we do have set aside for situations like that. As I said, a few things that I want to pull out specific, because I think a lot of this is, as I indicated just a little bit ago, the distancing, the enhanced cleaning, the other sort of protocols that are in place, that's we're already aware of that. We already know that those occur. So I want to play off of just sort of what's the most prevalent things in our Protect the Next 2 plan. The first thing is obviously what we're doing for testing and vaccinations and what we're doing for that. And so the first part of this, very similar to a lot of other institutions in the state, is we are mandating testing with an opportunity to opt out with a proof of vaccination. So we've started that process as well. I think ISU just indicated that they had started theirs about a week ago. We're going on week 3 of ours. So far, we have for employees, we have about a 43% individual rate that have indicated they've shown proof of vaccination. So 43% within a few, going on week 3. The caveat to that too is we just had 11-month contracts. Those are on 11-month contracts just started for the next year. So August 1 was a lot of people's, specifically faculty, their return to campus. So I anticipate that going up. We also, in the early part of May, did a survey to sort of get a pulse on where are we at as a campus, both overall employees, but overall students and employees together. We had a very good turnout from the employee side with over 50% of employees responding to that. And then cumulatively to that, about 71% of those indicated they're vaccinated. So I'm going to guess that we're at the 43%. I think by my projections, we're going to be in the 55 to 60% range at the beginning of the school year. Just like a lot of other institutions have indicated, it is our plan to work very diligently with our health department locally and to provide vaccination clinics throughout campus, both during move-in and then a couple of weeks after school gets started, as I anticipate some folks not wanting to get vaccinated, but then deciding that maybe this is a little bit more cumbersome than they wanted. And so we want to provide those opportunities for them too. So after the first couple of weeks, we will provide vaccination clinics and throughout the semester. Incentive-wise, we are providing incentives both for those that are participating in the proof of vaccinations, but also those that are participating in the testing process. We want to be very careful, and it's one of our goals, is students are calling it shot shaming. And we want to make sure that we value the choice and we value those individuals. We have changed our wording to say expect. So I know like IBHE's guidance, it says encourage. We've one-upped it, in my opinion, to say we expect. And that's what we keep telling individuals. We expect them to get vaccinated. But on those situations or circumstances where they can't, we want to provide that testing protocol and allow those that do participate that in the 15 weeks of the semester the opportunity to have some sort of incentive as well. So that's the incentive piece. The other thing is that I wanted to pull out is our response. I think that was a question that came up from another representative just a little bit ago, is what happens when we do have a positive case? I'm going to go on record and saying I think WIU has one of the best responses that we've had within the state and how we've dealt with it. We have 2 residence halls specifically offline for the use of quarantine and isolation. So we have 350 beds available for both quarantine and isolation and broken out by gender. And quickly, the process sort of works. We've done this many, many times and we get better at it every time. But basically the process is once a person is confirmed, we then work that through our health center on campus, which we call BU Health Center. Those individuals contact BU Health Center, our local health department to make sure that we're reporting that and we have the current updated numbers within the county. But then they also work with our Student Development and Success Center. And that office already provides that support. So like many campuses, we already sort of have a lot of this backbone already in place for students in crisis, students who are ill, that lose a loved one. We have the crisis management already built in. So it was sort of adapting and pivoting to apply that towards the COVID response. And so our Student Development and Success Center will work with that individual student who has a positive case. And I sort of allude to them as sort of the travel agent at first. And so their job is to really work with that student, educate them on what's happening, try to keep them calm, because it's quite hectic to understand that you're positive, and then pretty soon somebody's going to show up in a van and relocate you. And it's very embarrassing sometimes for individuals. It's scary. So their job is to help sort of manage that. We have a response team on staff, and I want to caveat to that too, is these response team members are people like myself, Vice President Braverman, other individuals that have gone, that basically sign up for shifts. We don't have the ability to hire other individuals just because of our region. It's hard to find extra help, as it is with a lot of other industries. And so it's people within our student services division, our rec center director, our counselors, our person who does retention. It's everybody signing up for extra shifts and working this through a 24-hour sort of time frame. And so once we get that information, we go and pick that individual up. We bring them to our residence hall. We notify them of how to get their food. We have a process in place for even if they wanted to get deliveries, because we understand even in quarantine, campus food isn't always the preference. So if you wanted to get Jimmy John's or something like that, we provide that opportunity. But we work with them to basically get them settled in, because they're going to be there for the next several days. After we sort of drop them off, they're then awarded a case manager. And that case manager is very important, because we want them to be that point of contact for campus, or for that student for campus. We don't want to give them a run around and have 15 different people involved. So that person is really their counselor or their case manager for that duration of the stay. And they work with them to get, if they needed a computer, for an example, if somebody left a blanket in their room, in the original room, we work with them on all sorts of things like that to make sure we can make them as comfortable as possible. We also provide testing during, for those that are in quarantine. We provide testing after day 5 there, just to help sort of give them a peace of mind and some ease of where they're at in terms of, if they're not symptomatic or if they're asymptomatic, understanding where they fall within that. And then also at the end of it, we set up relocation services for them too. So we'll actually pick them up on a Sunday morning and take them back to the residence hall. So we try to make it as seamless as possible. And that's our response and how we deal with it. A lot of questions come up about what are we going to do if numbers increase with the variants and just the sort of the unknowns. And so we do have a dashboard information that we are going to follow. I talked about our vaccine proof submissions, complicity and testing program, our bed counts, our 14-day average, our hospital ventilators within the communities of both Rock Island County and McDonough County, and then also obviously the guidance of IDPH and our local health departments. And so those are what we're going to use as sort of our barometers and our metrics. And somebody has suggested, and many times, well, why don't you have X, why don't you, like an airport, have green, orange, yellow, and red? Why don't you have certain metrics? And one of the things that we did look at that. And one of the things that we learned last year was that when we did our contact tracing appropriately and could identify the catalyst for some of our outbreaks, even though we met what we can probably consider the metrics of basically a percentage of positivity, what we were able to do is, because of that contact tracing, we were able to identify that particular maybe athletic team or that particular fraternity or sorority or another student organization or an event, to where we were able to pull those people out more timely and quickly, to where we didn't have to have and throw a holistic blanket over the campus as a whole. And so that was one thing that we learned very positive of. And we want to leave that as everything's changing, as we've talked about numerous times today. We want to have that play in there to be able to address things, have it there so people know that there's a caveat to that, but also know that these are the things we're going to follow. What would happen if we did meet these metrics or things sort of got out of hand and we had to backstep a little bit, is we would look at limiting or cancellation of events activities. We would cap some of our limits on different things. Our testing frequency, right now it is once a week. The reason we're doing that is, and we will know more here in a few weeks, or a couple of weeks, is just knowing how many people are going to have to run through our testing plan. It's fluid. And as we get better at this, I feel like we can be able to run more people through more often, but we want to be realistic with that. And we don't want to overstep and say you have to test 3 times a week and we're not able to manage that. So this is very manageable at this point. We'll build off of that and go from there. And then enhance protocols and restrictions related to travel. Another thing that we learned last year is that no matter what policy you have, there's always a lot of gray and a lot of people that want to be in that gray. And we want to be able to have a framework in place, but the ability to navigate that. And just like ISU explained previously, is our goal last year was to keep the doors open. Our goal this year is to bring back that collegiate experience and provide those students with as best of the college experiences we can provide. And that's what the goal is of this. I'll say one more thing, and I'll turn it off to Shannon to talk about how we've utilized CARE fundings. But the question we would have is, would we look at mandating? And the question is, or the answer to that is yes, we would. I think there's several things that play into our decision with this. Happy to go over those if it's asked. But really, we're waiting for, if the state said we had to do it, or it became a federal mandate, we definitely, or even if it came off emergency use authorization, we would definitely go back to the table and look at that. So this is our plan as it is right now, but we've left plenty of room and sort of asterisks in that plan to show and indicate that this is a very fluid situation. And if things change, it gives us room to go back to the table and to change our processes and mandates as well. So with that, I will turn over to Shannon Sutton, our interim vice president of finance and administration, to talk about CARES funding.
Good afternoon. Thank you, Joe. I'll just do a brief overview. So Western was thankful also to receive the CARES funding from the federal government. It certainly has helped, as other institutions have said. It does not begin to cover all of our costs. I'm not sure anything ever would, except a huge influx of money. Western has received a little over 43 million in total CARES funding. As of the end of June, we have expended to 17 million. That includes the student financial aid and the institutional funds. Similar to the other institutions, the CARES funding has been spent on housing and dining refunds when students went home when the pandemic originally started, lost revenue for those two areas, lost revenue for the institution, supplies, testing, technology, all of the areas I think that everyone else has spoken to previously. We too are looking this fall. We've got a plan in place that was just approved to help alleviate some of the student debt that is out there also. And we'll be using some of the institutional CARES funds to take care of that. So that's a broad overview. In the student financial aid, we've issued over 7,000 awards to students as emergency aid to them through the CARES funding, and that definitely has been helpful. Our financial aid office is very busy. They're looking to roll out the rest of the program this fall and into the spring in order to help the students that are enrolled and to help the students that were enrolled last year and were unable to come back, especially those that are carrying a larger balance, to see what we can do to re-engage them and bring them back to campus.
If I can mention just one thing too, I want to thank the folks at Western Illinois. I've just been here in my second month now, but I've been moved here from Massachusetts. I've worked in New York and in California on COVID relief. I think Western has done a fantastic job of dealing with this, and a number of my colleagues around the state. And I just want to give an attaboy to Joe right now, because as I come back, Joe is on his first vacation in 2 years. He's in Minnesota. So in the background, you see Sherman Hall on campus. And this is the second time this week he's been called into a meeting. So fantastic work, Joe, and thank you. And just want, on behalf of everybody here, thank you for coming forward and sharing with us.
Thank you. I think Representative Hammond has a question.
And thank you, Mr. Chairman. And thank you all, not a question. Thank you all for your comments today. And Joe, I will say you rocked it. And having Protect the Necks, for those that don't know, the leather necks are the mascot of Western Illinois University and our lifeblood, I will say. And what I witnessed about a year ago, what took place on campus to address the response to COVID-19 was nothing short of incredible. Western was housing Illinois State Police, the Illinois Emergency Management folks, the Department of Public Health. the sheriff's office, everyone, the hospital, every unit that you could imagine that was touched by COVID had a seat at Western Illinois University. And it was nothing short of amazing to watch that play out day in and day out. You had the finger on the pulse of it from the very beginning, and it sounds like you haven't let up on that. So thank you, and I appreciate everything that you've done, and I just pray that we have a safe start to the school year and all the way through. Thank you.
Thank you, Leader Hammonds. Representative Ford, you're muted.
Thank you.
I think we're going to move on. I'm not seeing anybody else seeking recognition. So next on our agenda, and I want to note we are slightly ahead of schedule, which is very rare in our situation here. But we have Governor State University. So if we could hear the representatives from Governor State.
Good afternoon, state representatives, state senators, staffers, community members, and fellow educators. I am Cheryl Green, president of Governor State University. With me today is Beth Kadam, the provost and vice president for academic affairs, who will speak about our plans for return to face-to-face instruction. Paul Balaska, vice president of finance and administration, who will talk about how we utilize COVID relief funds, and Therese Nohos, our general counsel and interim vice president of HR. This is a very busy time on our campus as we prepare to welcome back our students, faculty, and staff. Before we provide the information you have requested, I would take just a moment to talk about the uniqueness of the GSU campus community and how our demographics shaped many of the decisions we have made with regard to addressing the needs of our campus community as we prepare to address the challenges that face higher ed due to the pandemic. In short, it's important to know that GSU is primarily a commuter campus. The average age of a GSU student last fall was 30 years old. Many of our students have children. The majority of our students have jobs and many work full time. We are also a first generation student campus, minority serving institution, and we are a very high transfer student institution. This population was hit especially hard by the pandemic. And we realized they would likely require more assistance than the average college student. We responded as best we could to meet those needs and continue to stay attuned to the needs and challenges facing our student body. GSU is strongly urging our entire campus community to get vaccinated if they have not already done so. From mid-August of 2020 until August 1st of 2021, GSU has had a total of 55 students and 28 employees report testing positive for COVID-19. Within the last 3 months, there have only been 3 cases reported to campus. Our comprehensive strategies are showing meaningful results. Everyone entering a campus building, including our residential hall, is required to wear a mask, regardless of their vaccination status. Students will be able to discreetly upload their vaccination records through our software system called MedProctor. And we are looking into utilizing the same method for faculty and staff to upload their vaccine records. Of course, exemptions will be allowed where necessary, but students who are not vaccinated will be subjected to random testing on campus conducted by the SHIELD program. We also plan to expand our testing service to community members on a separate day. And we will continue to periodically offer vaccinations on campus through Walgreens based on demand. We began this activity in March of 2021. With regard to students specifically, all students were surveyed during the month of April and June to determine just how many were vaccinated. Of those who responded in April, out of all of the students who were surveyed, 45% reported that they are vaccinated. Of those who responded in June, 74% of the respondents stated that they were vaccinated. Again, these are self-report statistics. We continue to urge not just students, but faculty and staff to get vaccinated. GSU only has one residential building that houses close to 300 students, and it will be open this academic year with all the necessary precautions and protocols. A small percentage of beds will be reserved for isolation and quarantine purposes for this year, as we did last year. And last but not least, prior to our employees' return to campus, which began on Monday, we hosted a virtual back to work town hall. It was very well attended, and besides explaining our new normal, we fielded many questions and helped ease numerous concerns employees had. With the exception of our essential workers, many employees will split their work time between on campus and at home. The needs of the students, the program needs, the ability for supervisors to monitor and evaluate, and the ability for the work to be done at an excellent level are 4 factors that will drive those decisions. Our managers and supervisors have worked hard to make sure vital services will be covered at all times, keeping in mind the health and safety of our campus community. I'm happy to report that an MOU was agreed upon with our UPI chapter on July 16th. We will continue to update our COVID websites as we get new information and new guidelines. And finally, GSU has an emergency response team that has been leading our efforts to work diligently since the start of the pandemic. And they play a critical role in our ability to navigate uncharted waters. They stay informed on best practices of guidance by CDC and IDPH. Guidance from these health experts is vital and welcomed. Next, I'd like for you to hear from Provost Cater, who will talk to you about the academic plan for fall 21. Afterwards, Vice President Bilasco will share an overview of how the funds were spent to address the pandemic on our campus. And of course, Vice President Nohos and myself will also be available to answer any questions you may have at the end of our remarks.
Thank you, President Green. I am very happy to report after a successful delivery of instruction, primarily through remote delivery during academic year 2021, following our campus operating plan, we are excited to move towards instructional delivery for fall 2021 following our regular curricular processes that determine the course delivery methods. And that's including face-to-face, hybrid delivery, which is on campus, and online offerings for our students. Our student services are all going to be available both face-to-face and virtually. We gained a great deal of experience during last academic year and continuing to provide all services to students virtually, and as well as some limited face-to-face. As we return to the fall, we will have both methods available for our students. That includes student health and counseling for our students who have really much appreciated the opportunity for virtual counseling. Also our financial aid, our student resource center with tutoring and academic supports, academic advising, our library. We've also provided student loaner laptops and internet access and hotspots for many of our students. We are following our classroom health and safety measures as designated on our operating plan. As President Green mentioned, masking for all indoor interactions in the classroom, regardless of vaccination status for our faculty as well as our students. We are following our cleaning protocol. Our classrooms will be cleaned in between each class session, following our cleaning protocol for public spaces on the campus also. We have improved ventilation in all of our classroom spaces and added additional MERV 13 filters where needed. We are providing hand sanitizer, extra masks, wipes for cleaning in all of our classroom settings and common spaces in the university. As President Green mentioned, we will continue to provide shield testing for our campus community as well as our community at large outside of our campus. We will continue to run our vaccine clinics, which we have provided not only for our campus community, but for our external community. We're very proud of that relationship. And we also want to continue to encourage, and this is part of our operating plan last year, daily personal health checks for our campus employees, our faculty, staff, and students. And we do that through an app that we have where we are encouraging people to do a daily health check before they come to campus. As President Green mentioned, we have one housing unit, the semi-suite rooms. We've been working to continuing our education about health and safety measures, not only for our residential students, but also our campus students. We have provided an online educational unit for talking about health and safety in the COVID environment. We will be following all of the cleaning and safety measures that I mentioned previously in our residence hall. We will maintain, as we have in the past, some suites available for quarantine purposes, food deliveries available from food service if for any reason students have to be quarantined. And if necessary, we'll continue with this education, working with student concerns on a case-to-case basis. And if necessary, we do have student conduct policies and procedures that we can follow. So that concludes my report, and I'm happy for questions at the end of our presentation. I'll turn this over to Dr. Belasco.
Thank you, Provost Cada. Regarding the expenditure and commitment for HERF funding, we are pleased to note that we distributed funding to 1,932 students from HERF 1 funding based on a survey indicating personal family impact and eligibility for federal funds. When the HERF 2 money became available, that was distributed to over 4,000 students based on the financial need, also full or part-time status, and undergraduate graduate status. HERF 2 and HERF 3 were also supplemented by donations to our foundation, which helped to meet unmet student needs in special areas. In terms of our university portion of HERF funding, of course, it was expended for the COVID response, including the items that Provost Cada mentioned, PPE and air quality, and also provided continuity of instruction and online course development. We provided mental health and counseling training and support. increased technology to move much of our instruction to hybrid remote delivery, including equipment, software, and individual student and faculty connectivity. Of course, part of it had to cover revenue losses, including for housing and for tuition and fees, and also to supplement our Faculty Development Center and the parent and child care needs that were impacted by COVID-19. And finally, for HARF 1, there was payroll for additional instructional support and student help. For HARF 2 and HARF 3, we are committed to further fund COVID-19 response and planning, but also for the potential return to campus, including continuing development for remote instruction, additional sections and faculty to support social distancing once students and faculty arrive to campus, retention students to support at-risk students, and an upgrade to our intervention support to manage large caseloads and identify individual student challenges, including the lingering impact of COVID-19, and for special problems in handling remote delivery. And additionally, in interventions ensuring that our students are prepared for the COVID-19 work environment when they graduate from the university. And finally, we provided training on COVID-19 related issues such as anxiety, trauma, anger, grief, eating disorders, and depression, which have unfortunately accompanied the COVID-19 challenges. That includes our report on use of CARES funding, and I give it back to the president to address your questions.
I'm not seeing any of our members of either committee seeking recognition. Chairman Ford, is anybody?
I don't see anyone.
Okay. Well, thank you. Thank you for that update. And that'll lend us to our next, which I believe is Southern Illinois, if I'm not mistaken.
Yes, I believe that's true.
Yes.
So first of all, good afternoon, Chair Ford, Chair Stewart, spokespersons, Kiker and Brady, and all the members of the committee. I'm Dan Mahoney, the president of the Southern Illinois University System. I'm happy to be. Yes.
I want to, Representative Mazzocchi, were you seeking recognition for Governor State, or are you?
Again, both. I'd asked all of the universities, thank you, Chairman Stewart. I had asked all of the different universities to state whether it was going to be their policy that they would terminate teachers who did not comply with their vaccine requirements or not. So I don't think I got an answer on everybody's.
Okay. All right. Well, thanks. We'll go back to President Mahoney. Thank you.
All right. So again, thank you for the opportunity to address. Oh, you want to go?
Feel free to answer that too while it's your turn. Thank you.
Yeah, I'll get to that in my comments as well. So I'll just work that into what I was going to talk about. Again, thank you for the opportunity to talk to you about our campus plans for the fall. I'm pleased to be joined by leaders from both of our campuses. Chancellor Lane from the SIUC campus is with us, and Miriam Rachia, who is the Associate Vice Chancellor at the SIU Edwardsville campus, are both here if you get into questions that are very specific to their campuses. Obviously, it's been a challenging year for us and a great deal of continuous planning as we've adjusted to the pandemic over the last 16 months. We are excited about returning for fall classes, and we'll be up substantially on the number of on-ground classes and face-to-face classes we have in the fall on both campuses. I will say it's important to note that the COVID did not dampen our recruiting efforts. On both campuses, our admissions staff, our faculty, our leaders were on the front lines in readjusting how we reach out to potential students and their families, and really have done a lot of outreach in a different format than we're used to, but it actually seems to have worked very well. I'm pleased to say at this point that we're up on applications across the system, admissions, and registrations for the fall semester. A lot can happen in the last few weeks, as I've learned over the years, but if things were to hold we would be up on both enrollment and new student enrollment when we start the fall semester on both the SIUC and SIUE campuses, and we're quite pleased with that. I'm going to focus on the things you've asked us to focus on, which really is our plans for returning to campus with a particular focus on what we'll do with housing, what we would do if in a COVID 2.0 situation where there's an increased risk beyond what we're seeing today, and also what we've done with our COVID relief money. And then again, we'll answer any questions that you have. We continue to seek guidance from a variety of sources, including the Illinois Department of Public Health, the CDC, and in fact, our own experts we have within our own system on what to do as we go forward. On vaccines, both campuses are strongly encouraging vaccinations for student, faculty, and staff. For students in particular, we are providing various incentives, both individual incentives as well as group incentives. So for certain student organizations that get up to a certain vaccination rate, providing them money to help support their student organizations is one of the incentives that we have. Because we're not requiring the vaccine of faculty, obviously, we would not have the issue that was brought up earlier about dismissing faculty who refuse to be vaccinated. Again, those who are not vaccinated and have not had the COVID disease recently are expected to participate in testing when they come back in the fall semester. And we'll continue with that testing for as long as that's deemed necessary. We will be doing mask wearing in all indoor spaces, with the exception of individual offices, and that obviously includes classrooms. And we are encouraging students and others to socially distance as well. Those who are unvaccinated may be wearing masks longer, but again, we will adjust as the guidance that we get adjusts over the semester. I will say, in addition to the things that we did last year as far as cleaning and other things to help make sure our campus is safe, when it comes to housing, we're in somewhat of an unusual situation, which has been somewhat helpful, I think, right now, in that we have an excess housing capacity on both campuses. So on the Carbondale campus, about 99% of our students live in single rooms. So the roommate issue is not one we face there. It's about 46% on the Edwardsville campus that are in single rooms or in family housing. So the number who are with roommates is relatively small. And we have enough capacity that if there is an issue between roommates or whatever, we can easily move someone into a single room. We also have enough capacity to deal with quarantine and all of that. And so that was not at all a problem for us last year. And in fact, we had enough capacity. I know we had some situations where students living off campus tested positive, but we're living in a large group setting. We were able to move them into our residence halls on a temporary basis to make sure they were not infecting the students with which they were living with, even when they were off campus. So again, having that excess capacity in housing has helped us quite a bit. Each campus is going to have a rigorous protocol for move-in days, and that includes spreading it out over a longer period of time and people signing up for specific move-in times, very similar to what we did last year. Again, spread out over several days as opposed to several hours, which is usually what we had in the past. And students will get specific instructions for the activities, use of the residence halls, what they can and can't do, and where they're expected to wear masks, as well as with the dining. Masks, again, will be worn going in and out of the dining halls and in line for food, but when they're eating, obviously, that would be the one time they would take off masks. We do have also, when it comes to employees, we developed over the last about a couple months ago an SIU system remote work policy that helps serve the needs of our employees who need to work in spaces other than their offices for whatever reason. And so as, again, we see what happens throughout the fall, we now have the flexibility to deal with that and have a policy to dictate how we would do that. So that's a little bit about our kind of coming back to campus and housing issues. If things get worse again, I've said to the Appropriations Committee when I met with you earlier this year that I started 9 days before we went totally remote. So I know what it's like to have to make changes quickly. This time we're obviously much more prepared and are meeting much more regularly to talk about different scenarios that may or may not occur in the future and making sure that we are prepared as much as possible to do that. Again, we do have, I don't think we'll be going back to anything like we did last year of totally online education. That I'm not expecting to do, but we do have flexibility if it's needed in certain cases. You know, one of the advantages we have because of what happened last year is now all of us know how to teach online, myself included. I taught 2 classes online last year. I'd never done that before last year. So a lot of our faculty are more used to transitioning those classes if that was necessary. Again, don't expect that at this point. We expect to be, again, primarily face-to-face across our system. I will say over the last few semesters, we've learned quite a bit. And we've handled this actually quite well. We've had no setbacks. We've maintained low positivity rates that are on par really with the most successful universities in the country, very, very low rates. So the things that we did last year were very effective, and I have a lot of faith in the ability of the people within our system to adjust if we need to adjust again this year. So again, very proud of what they were able to do last year, and I think we're ready for whatever may come in the future. I will say too is we're encouraging faculty and staff to be vaccinated before we begin the fall. I do want to say we did do a survey very recently. We just got the results last week from the SIUC campus. What we found was 75% of our students were fully vaccinated. Another 4% had the first dose and likely would be fully vaccinated. So we're fairly close to 80% of our students that would be fully vaccinated. Our faculty staff numbers was closer to 90%. I think a little higher for faculty than for staff. So we actually have a fairly high vaccination rate across what we're seeing, at least across our students, faculty, and staff as we go into the fall. So we believe that combined with the mask wearing and the other safety precautions and cleaning and everything else, we have a pretty good chance of keeping any outbreak to a minimum. And so that's what our plan is, again, for the fall. And again, if we have to adjust like we did in the past, we will. The last year, obviously, as everybody else has mentioned, has been incredibly challenging from a financial standpoint. And we are very appreciative, obviously, of the support we received in the 3 rounds of federal COVID relief funding. It did not certainly cover all of our losses, but it helped cover some of them and actually provided much needed support for our students during what was a very difficult time for them financially as well. As you know, some of the money was designated specifically to help students, and we focused that on getting money to those who were the most needy, particularly the Pell eligible students. So I think across our system, we got money to about over 10,000 students during the various COVID relief funding periods. So we were able to help out quite a few students through the money we got there. The money that was designated for the institution, so the money we had flexibility to use for whatever purposes that were related to COVID and were covered under that legislation, we were able to cover the cost of some of the housing, dining, and other refunds that we had to provide. We were able to reimburse areas of the university for revenue that was lost during the pandemic. We purchased items to improve safety that included testing supplies, masks, hand sanitizer, all kinds of different things to make sure the campus was as safe as possible. We were able to purchase things to help with academic support for students that included laptops, hotspots, upgrading closed captioning for students who are taking classes online who needed that. So we put money towards those things, as well as additional support for different student things, including mental health support. We also paid our student workers during the end of the last spring semester and spring of 2020 who were no longer able to work because their jobs, again, required them to be on campus and we had sent them home. We continued to pay them during that period of time, again, concerned that they would lose that financial resource that they were really counting on. I should also point out that some of the money that was designated towards the university, we have also been using to help our students out. So in addition to the $44 million we got to help students out, some of the $54 million we got across the system to help the university with these expenses, we've actually put that into helping students pay down balances, be able to come back to school and deal with some of the financial impact of the pandemic on them and their families. So we've used even more than the $44 million that we were given. We plan on using even more of that to help out our students. This has been, again, a particularly challenging year, as everyone has said. The state is, again, investing in higher education, and we are very grateful for the support that you provided. We hope this continues as we try to regain from the losses that we've had in the past and had during this past year. We're really excited about the fall semester. We're excited about students being able to come back and have a more normal. It'll be a little different than it was 2 years ago, but certainly different than we saw last fall when we started up. Again, I'm very appreciative of the support of our elected officials. Welcome you to visit our campuses at any time. And now I will turn it over to any questions that you have for me or for the campus representatives.
I'm not seeing any other members seeking recognition, but I just wanted to ask, and I may have missed you saying this, and I apologize if that's the case. Will you have vaccination available on campus?
Yeah, I'm sorry, I forgot to mention that. Yes, we will have vaccination available on both the campuses for those who are not vaccinated. Yeah, and we are seeing, actually, we'll say one of the things we saw with our survey is for some of our international students, particularly in Carbondale, have not been able to get the vaccine where they are and are anxious to get it as soon as they get here. So again, that 80% of students that are vaccinated, I expect that to go up once they have access to the vaccine when they arrive back on campus.
Terrific. I just one more check to make sure that my colleagues have an opportunity, and I'm not seeing anybody seeking recognition. So thank you very much. Again, campus looks beautiful here in my neighborhood, and we'll hear from Eastern Illinois.
Madam
Oh,
Chair, if we can,
ahead.
I think
Sure
Paul
thing.
Jacobs is trying to wave his hand.
Oh, okay. I'm sorry, Representative Jacobs.
For some reason, my little hand in my
Doesn't, okay.
it doesn't come up for some reason. I just wanted to point out the sanity that our universities in Southern Illinois, Carbondale and Edwardsville, both are creating with not a mandate to vaccinate, but are letting the people decide. But we are hitting 80% with that, which is way above our herd, immunity. So we should be, I think, really, really good, and maybe consider letting the people still decide. I personally recommend it to every one of my patients. I recommend it to anybody. Go talk to your physician, get the vaccine. I think that it is, it's been around for 20 years. It's not just brought up this last 2 or 3 years. It's been around a long time. I think it helps. But I also agree with Representative Masaki that if you've already had it, according to what we have learned in the past, you're not going to catch that one again, and you have the antibodies. So, but I just really appreciate the university's approach down at Southern Illinois, both Carbondale and Edwardsville. Thank you. Thank you for being here.
Thank you. And I will say we are strongly encouraging it. I have 2 college-age students in my house, and they are both vaccinated, including the one who had COVID, but we got them both vaccinated. We're trying to get as many people vaccinated as possible. We agree with you. It's a good idea.
Thank you. Thank you, Representative Jacobs. I might have a few of my constituents. I might ask you to give them a call and explain it as well as you did, the importance of getting vaccinated. We'll move on. We'll hear from Eastern Illinois. Thank you, Dr. Mahoney.
Good afternoon, Chairperson Ford, Chairperson Stewart, Leader Brady, and Spokesperson Kiker. First of all, I want to thank you all for allowing us an opportunity to share with you what's our activities here on our campus here in Charleston, and on behalf of President Glassman and the entire leadership team here at Eastern Illinois University. We are excited about fall and look forward to returning to face-to-face activities primarily across our campus. I can assure you, like our colleagues, our practices are informed by the CDC considerations for higher institutions of higher education, as well as the IBHE guidance we just received last month, and indeed an update today. We're following those guidance, and it's given rise to a number of practices from last year that will continue, whether that's our improved HVAC sort of efforts, as well as portable HEPA filters, sanitation stations, and so on. And we've also sort of committed to having our own contact tracing activities here on campus. That's faculty led, with our own graduate students and undergraduate students working in those roles from our public health program. In terms of our return to campus and academics, physical distancing will be available in all classrooms. All students will continue to be masked in classrooms and labs and studios, and that's important because we don't want to, I think one of our colleagues talked about shot shaming. We want to make sure that everyone's comfortable and that everyone's safe. And so masking will occur in all learning environments over the course of the year. We're also, and as a result of our prioritization of face-to-face, I'm pleased to report nearly 85% of our courses are going to be face-to-face this year. There are, of course, some limitations as a result of physical distancing and just the capacity of our physical infrastructure. But we're very pleased that 85% of our traditional campus-based programs are going to be face-to-face for all courses. So that's a huge, huge win. In terms of academic contingency planning, I'm also pleased to say we have a plan that's been developed by the Associate Deans and the Academic Affairs leadership. Should we move back to a different phase? It's based upon last year's phase system, as well as the tier mitigation experience we all sort of had around the state and over the course of the past year. We feel very confident we'll be able to deliver a high quality learning experience for every learner on campus and keep everyone safe over the next year. I am joined today by my 2 colleagues, Ann Flaherty, our VP for Student Affairs, and Sean Reeder. And I'm going to ask Ann to talk about our vaccination verification practices and student life and residence halls activities. Ann?
Thank you, Jay.
Good afternoon, everyone. Similar to last year, we are putting in place practices to keep our positivity rate down as we did last year. In terms of COVID testing and protocols, as of this past Tuesday, August 3rd, all employees and students were asked to verify their COVID-19 vaccine status through our online PAUSE system. For those who are not vaccinated or who have not verified their vaccination status, they will be required to participate in our mandatory randomized Shield Illinois surveillance testing program that will be in place every week. The first round of that verification will be the first week of classes, which will be 8/23, and that will be determined by what has been submitted as of August 18th. Similar to last year, we have designated quarantine and isolation space. We have 40 designated spots, but we can, like similar other institutions, we have additional space available on campus to accommodate any surplus beyond that. We are continuing with extensive cleaning and sanitizing processes in our halls. We have our COVID transportation team that will transport students to designated housing if they don't have their own transportation. And those students in quarantine and isolation also are fed through our catering department. And we will have vaccinations available on campus at any point, including during move-in. In terms of student life and our residence halls, we have offered up single occupancy grants to our students at the cost of a double rate through our CARES funding. As of this past week, we had 900 students who have requested that option. That's about 600 higher than a typical year for singles. For those who are in doubles, similar to other institutions, we're treating the residents in the room as a single family unit. Of course, masking is required indoor everywhere on campus, with the exception of your own individual private residence hall or apartment or in individual offices. We are resuming normal dining operations, masking required when not actively eating. We're moving ahead with our Welcome Week activities, mostly pre-COVID, with some exceptions of some of our previous off-campus service projects are being modified a bit. We're continuing with our some telecounseling options. That has also been a positive from COVID. We've shifted to offering both in-person and video-based counseling, which has been very well received by our students. We are updating our welcome guide and campus guidebook to go out to our new and returning students. And essentially, we are just excited to create a more normal experience for our students this year and hopefully have a positive year with very low positivity rate. So that's from the student life and COVID testing protocol. And then I'll turn it over to my colleague, Sean Reeder, who will talk about the financial pieces of this.
Thank you, Ann. As our colleagues across the other institutions have previously indicated, we are very appreciative of the state's consistent funding in this past trying year and thankful for the additional federal relief and state support for our COVID relief efforts. In total, EIUs received $28.6 million in relief funds. Of that, $11.5 million is dedicated for direct student relief. We have another $1.5 million that is being used for student support activities on campus. And then we have approximately $16 million that is available for institutional funds to be used to cover our ongoing costs for addressing the COVID environment, as well as lost revenues. Also, as others have indicated, these funds have been immensely helpful. However, as we continue to deal with the COVID protocols and impacts on both cost and additional lost revenues, they will fall short of what the total impact will be. And we're hopeful for continued support from the state and possibly additional federal relief as well as we move forward in time. Our costs are similar, our expenditures are similar in categories to what has been described by other institutions as well. Costs related to providing for a clean and disinfected environment, refunds back to students, helping to bridge the technology gap with additional Wi-Fi capabilities, laptop computers, as well as providing for additional supplies and equipment necessary for addressing the various responses we have due to COVID. I'm happy to go into any more detail regarding our COVID costs as well. And I do believe that Provost Gatrell has some additional comments as well. Okay. Jay, you're muted.
Sorry about that. And finally, I want to close and by thanking our faculty and our staff and really the entire community, because what the plan we developed couldn't have been done without the partnership of our colleagues across multiple negotiated units. In fact, like Governor states, we were very pleased to come to a memorandum of understanding with our colleagues on June 30th in the UPI, because safety on our campus for our students and staff really is central to the mission and the task for fall 2021. So thank you for taking the time to learn about what we're doing here on our campus. And I've appreciated learning from my colleagues across the state. So I welcome any questions.
Thank you. And thank you for sharing all of that with us. I think this shows that you're being responsive to the questions that we had posed, because I'm not seeing any of my colleagues seeking any further questions. I don't think I'm missing anybody. So I think we can hear from Northeastern Illinois University. Thank you very much.
Good afternoon, everyone. Chair Ford, Vice Chair Smith, Republican spokesperson Kiker, Chair Stewart, Vice Chair West, Republican spokesperson Brady. I want to thank you for this opportunity to speak to you today on behalf of Northeastern Illinois University. I am Gloria Gibson, the president, and it is my great honor to represent the faculty, staff, and students at Northeastern Illinois University. Joining me today are the provost, Dennis Rome, vice president for finance and administration, Manish Kumar, vice president for student affairs, Terry Minna, senior executive director for government relations, Solema Perez, and the co-chair of our NEIU COVID task force, Sharon Highbaum. After my opening statement, Provost Rome will provide an update on our academic affairs, VP Kumar an update on facilities and human resources. He will then transition into a discussion of how our campus is spending our CARES funding. VP Minna will provide an update on the NEST, our apartment style housing, and our vaccination incentive program. And I will conclude with just future plans in case there is a COVID 2.0 and our brief closing statement. NEIU remains committed to the health and safety of our faculty, staff, and students. As president, this is my primary focus. Our COVID-19 task force has worked diligently over the past year and a half, providing current information to our campus through campus-wide forums, weekly updates, and a detailed website. Earlier this summer, NEIU disseminated an interim COVID-19 return to campus policy crafted under the strict guidance of national, state, and local health professionals, as well as Northeastern's COVID-19 task force. The policy is intended to mitigate the risk of spreading COVID-19 among students, faculty, staff, and community members as they continue to return to all university locations. NEIU is returning to campus in phases. Beginning in July, some critical offices reopened, adhering to strict COVID-19 protocols. This week, most administrative staff returned. Our faculty will return in mid-August, and classes begin August the 23rd. We offer shield testing on campus, and we are partnering with Heartland Health to provide on-campus vaccinations. Our return to campus policy reflects a layered approach to protection. First and foremost, we are strongly encouraging faculty, staff, and students to get vaccinated. We are introducing an incentive plan, which we will detail a little later, to encourage vaccinations. NEIU has not yet required mandatory vaccinations. NEIU's approach does mandate all individuals, whether vaccinated or not, must wear face coverings in public indoor settings. We have never wavered from this requirement. Other areas of our policy address reasonable accommodations for employees with disabilities, general health and hygiene, social distancing, meeting and event protocols, and self-screening protocols. Each member of the leadership team will now give a brief overview of their area.
Thank you, Dr. Gibson, and good afternoon to esteemed members of the committee. I'm Dennis Rom, the provost here at Northeastern Illinois University. As President Gibson has explained, the safety of our students, staff, and faculty are paramount, and the president has described some of the Herculean efforts and vast resources we have employed in keeping our campus safe. As a result, last year, we offered over 90% of our courses in a remote format. We conducted a survey at the end of spring semester and learned that a majority of our students desire face-to-face classes. Given this preference of our students, coupled with the demographics of our student population, we are offering approximately 75% of our courses face-to-face, and the remaining 25% will be offered remotely this fall. Students and faculty are required to wear masks during class, and students enrolled in lab courses will have work areas divided using plexiglass. Our student support services, including library, advising, tutorial services, and other student support areas are ready as we continue to dedicate our efforts to support our students' education and ensure the safety and health of our university community, no matter the circumstances.
Thank you, Provost Rom. Hello, everyone. I am Manish Kumar, Vice President for Finance and Administration here at Northeastern Illinois University. As President and Provost mentioned, safety is our highest priority. The university created a COVID task force that included members of our emergency management team. These groups have been meeting regularly to address NEIU's ongoing COVID-19 mitigation effort and to create plans for the safe return of our students. And as President mentioned earlier, an interim COVID-19 policy, return policy was released in July 2021, and that outlines the expectations and mandates of our campus community. We have also provided information regarding the health resources and benefits available to our employees on our website. At this point, over 23,000 engineering hours have been spent on preparing for the full return of our community to campus locations. Our facilities management staff has ensured that NEIU has met or exceeded all industry standards for building, heating, cooling, ventilation, and air conditioning, including the recommendations for reducing the spread of infectious aerosols set by the American Society of Heating, Refrigeration, and Air Conditioning Engineers. All locations have been deep cleaned and sanitized. All classrooms and offices will be deep cleaned for a second time before August 23rd. Northeastern has supplemented its cleaning with the use of an electrostatic sprayer to apply disinfectant on high-touch surface areas. Masks are mandated to be worn in all indoor locations. Hand sanitization stations, sanitizing wipes, personal protective equipments, and social distancing and mask requirement signage has been distributed throughout the university locations. Also, in preparation for the fall's increased on-campus population, additional cleaning staff have been hired. We have performed inspections, cleaning, and preventive maintenance and monitoring of building automation services to maximize airflow while continuing to control building temperatures. MERV 13 filters have been installed in all buildings to improve air filtration as recommended by ASHRAE. Regular communication regarding our health and safety efforts are continually shared with our collective bargaining units, students, faculty, staff, and other stakeholders. We will continue to closely monitor and maintain all building systems and equipment, as well as ensure cleaning and disinfecting protocols continue to be followed. With that, I will move on to how we spent our CARES fund. NEIU received 3 awards of HERF student portion funding totaling 15.9 million. The university distributed 100% of the first 2 awards received, totaling 6 million paid directly to the students as emergency financial aid grants. The funds were distributed to students based on the number of credit hours enrolled in each semester. So a full-time 12 credit hour student received a cash payment of approximately $500, and Pell-eligible student received an additional cash payment of approximately $200, totaling $700. NEIU received 3 awards of HERF institutional portion, totaling 20.9 million, and 2 awards of HERF MSI portion, totaling 1.2 million. 1 million of those funds were distributed to the students in form of refunds, covering a portion of their mandatory fee for the interrupted spring 2020 semester, as well as special circumstances award to students most in need. In order to reduce the spread of COVID-19 and lower the risk of exposure, the university dedicated 4 million of HERF institutional funds to facilities infrastructure upgrades, including HVAC, ventilation improvement, PPE equipments, adjustment of work stations placements to allow physical distancing, allowing no-touch fixtures in restrooms, as well as frequent sanitization of campus. In addition to ensuring the health and safety of our community, the pandemic led to an urgent need of technology improvement, allowing us to pivot to a remote network environment in a short period of time. Consequently, the university invested approximately $7 million in IT infrastructure, allowing teaching materials and methods to change rapidly to a format suitable for online delivery. Active workshops and seminars were delivered to update staff and faculty on how to handle online platforms and adopt new electronic methods. The university invested in video conferencing services, adopted digital forms of data transmission, updated softwares for automation, and upgraded classrooms for virtual learning. To assist those students affected by the digital equity gap, the university developed a laptop loan program and added new Wi-Fi spaces. Additional enhancements to assist students experiencing difficulties accessing a computer outside of the campus environment to complete their coursework were also made. Lastly, the university is estimating it will lose approximately $16 million in revenues due to pandemic. NEIU plans to cover approximately 8.2 million of the projected lost revenues from HERF institutional and MSI funding. Now switching over to the GEARS fund, the NEIU received the second highest allocation of GEAR funding because of the high number of underrepresented, low income, and first generation students we serve, and our unwavering commitment to ensure equity in access, opportunity, and success in higher education for each student. The university would like to thank the governor and IBHE for this generous grant. The university has budgeted and continues to spend GEAR funding to provide 1.4 million in financial assistance to students in form of scholarship, housing assistance, and tuition, and free debt relief to support and mitigate any interruptions caused by COVID towards their degree completion. NEIU invested 1.3 million in a customer relationship management CRM system that supports the university's enrollment, retention, and on-time graduation effort. NEIU also devoted resources in recruitment and branding to reach new market and provide critical information about post-secondary opportunities and enrollment with the highest impact on underrepresented students, the majority of whom are first generation and low income. With that, I conclude my report and I hand it over to VP Mena.
Thank you, VP Kumar. Good afternoon, distinguished members of the House. I'll be speaking on our plans for resident students to join us in the fall in our building. Northeastern's resident hall is called The Nest. It's a public-private partnership with American Campus Communities. The Nest has a capacity of 440 beds, of which 37% occupancy are expected to live on campus this fall. Resident students are required to test before moving in. And if we have a resident student who tests positive after move-in, we have established 16 bed spaces which are being held offline to accommodate quarantine needs. We also establish a rigorous cleaning protocols that all surfaces and common areas are sanitized daily. Examples of door handles, elevator buttons, and study rooms, and etc. All resident rooms will be sanitized and sealed before residents move in on our move-in dates. Furthermore, the university has set aside funds for health services related to COVID-19 testing and is implementing a vaccine incentive program to motivate the community at large to get vaccinated. NEIU plans to expand student disability services by improving hearing impaired accommodations and adding additional counseling services staff and services to help mitigate anxiety, stress, and mental health issues during this pandemic. Telephonic behavioral health services have been procured to provide immediate healthcare access and crisis counseling to students, faculty, and staff during the evening and weekend hours. In regards to our vaccination incentive program, we have created an NEIU vaccination incentive program using HERF-3 funds to provide incentives for students, faculty, and staff to receive or who have received the COVID-19 vaccine. The program will strongly encourage all students, faculty, and staff at Northeastern to become fully vaccinated in order to help maintain the health and safety of the NEIU campus community. Upon getting vaccinated or showing evidence of receiving the vaccine, students, faculty, and staff are eligible to be drawn to receive prizes. Student prizes examples include 2 tuition reimbursement, free courses, laptops, bookstore gift cards, and free parking, to name a few. Faculty and staff prizes example include laptops, Apple Watches, free parking, to name a few. It was mentioned earlier that we provide shield testing on campus. We are offering voluntary saliva-based PCR testing, which is available free on campus, 4 days per week. And the results are available in 12 to 24 hours. Additionally, we have COVID vaccinations that are available free on campus through a community agency. There was a question earlier asked about non-compliance for resident students not wearing their mask. As our previous colleagues mentioned already, we have trained staff who take an educational approach as our first response through roommate mediation. We also have the option for room reassignments as a last resort. This past year, we've had no issues related to this type of circumstance.
Thank you, colleagues. I will close with saying that should a COVID 2.0 scenario arise, we are prepared to pivot back to remote operations if necessary. We will continue to dedicate all our efforts to support our students' education and ensure the health and safety of our university community. In closing, let me once again thank the committee for your past support and for giving us this opportunity to speak on behalf of Northeastern Illinois University. And we would be pleased to answer any questions that you might have. Thank you very much.
Thank you. And I think we are all hopeful that these mitigation strategies and plans that we all have are going to stop our institutions from having to go back to that fully remote. But I appreciate that you're ready to pivot should that be deemed necessary. I'm not seeing any of my colleagues seeking recognition. So we will move on. And last but not least on our agenda, and thank you everyone for your time today, and thank you Northern Illinois for waiting. It is your turn to share with us your plans.
Well, good afternoon, Chair Stewart and Ford, and Vice Chair Smith and West, Spokesman Kiker and Brady, and all members of the committees. My name is Matt Streb. I'm President Freeman's Chief of Staff. I'm also the liaison to NIU's Board of Trustees. And I have here with me today Beth Ingram, who's our Executive Vice President and Provost, and Sarah Chania, who's our Vice President for Administration and Finance and our CFO. Because of the hour and because many of our plans are very consistent with our sister institutions that you've heard, we'll be fairly brief, but obviously we're happy to answer any questions that you have. I'll discuss our return to campus plans. Sarah will give a high-level overview of how we've spent our CARES funding, and then Beth will discuss how we've worked with our students to help them succeed during this challenging time. We are really excited, like our colleagues, to welcome our students back to campus in 2 weeks for what we hope will be a more traditional fall semester. But not everything will be back to normal, however. Currently, we require face masks to be worn indoors, regardless of vaccination status, unless the person is in their personal workspace, private residence, or eating or drinking. In terms of the vaccine, we are requiring that all students who either live in on-campus housing or are taking at least one in-person class be vaccinated. We've provided a $100 stipend for students to do so. We do have 3 exemptions, however. We have the traditional religious exemption that many places have. We also have the usual medical exemption, but we have what we call our personal exemption as well. And that is, as you all know, all 3 of the vaccines approved in the United States are under EUA right now. Until those vaccines receive, or a vaccine receives full FDA approval, students can request an exemption. So, as I said, we're calling it the personal exemption. Any student who receives exemptions from the vaccine will be required to test weekly through our SHIELD surveillance testing program. As of this morning, we received vaccination cards or requests for exemptions from roughly 60% of our students. More than 88% of our students are fully vaccinated. Of the roughly 12% who have requested exemptions, almost 80% of those have requested the personal exemption. We are not requiring employees to be vaccinated. We estimate that about 80% of our employees are vaccinated. But like students, any employee who does not provide proof of vaccination will be required to test weekly. And obviously, we're not requiring it of our employees. Will not be terminating any employees who are not vaccinated. Through our partnership with the DeKalb County Health Department, we do have regular vaccine clinics available on campus, including we'll have vaccine clinics available the entire week of move-in. In addition to our vaccine and surveillance programs, we regularly test wastewater on campus and in our highly populated off-campus student areas, so we can anticipate any outbreaks. In terms of the classroom, roughly 70% of our classes will be in person this fall. That's compared to roughly 20% a year ago. Another 10% or so will be hybrid, and the remaining courses will be online. We scheduled classrooms at a reduced capacity to allow for 3 feet of social distancing, and as of now, require face masks to be worn in all classes. For those students who have concerns about in-person learning, our advisors are working with them on alternatives, including taking the course virtually or substituting online courses that will help them progress toward their degree. In terms of our residence halls, we will allow students to have roommates this year. That is different from last year. All of our students who lived in our residence halls last year were in single rooms. But as with last year, we do have an abundant quarantine and isolation space available for those residential students who need it. And for students living in our halls who are unvaccinated, we'll require them to get a gateway COVID test before they're able to move into their rooms. I'll now turn it over to Sarah so that she can explain how we've used our CARES money.
Thank you, Matt. Good afternoon. I'm Sarah Chania, Vice President and CFO for NIU. Thank you for your time this afternoon. NIU is very thankful for the federal relief funding we've received. To date, in total, NIU has received approximately $84 million across all 3 of the federal relief funding packages, including the GEAR funding awards, to award to students and to aid the institution. Simply put, without this relief funding, NIU and our students would not have been positioned to withstand the impacts of the pandemic. Most importantly, the aid that went to students directly helped them to stay in school and continue forward to degree completion, especially our underserved students who are in a vulnerable population when it comes to COVID. Of the total amount of funding available to NIU, $36 million in total has been used to provide grants directly to students. Not only did NIU provide automatic grants to students, we made available additional funding for technology, including Wi-Fi hotspots and laptops, and we offered student emergency grants to respond to critical personal situations. Provost Ingram will talk further about the funding awarded to students. The remaining relief funding awarded to NIU helped us to offset additional costs, responded to revenue losses, and allowed the flexibility to address facility and technology needs. Again, prioritizing the health and safety of our campus, the availability of this funding has provided NIU with the ability to refund to our students costs for housing, parking, and student fees in 2020. Many of our students, however, rely on on-campus housing and do not have another safe and reliable housing option. As decisions were made in March of 2020 to close residence halls and ask students to return home, NIU did keep our residence halls open and offered students a safe place to stay, as well as food options during the early months of the pandemic. This prior year, the relief funding allowed us to move forward with offering single housing options to students at a reduced cost. In addition to reducing density in the residence halls, we also reduced density in our dining facilities and offered prepackaged meals and other options for the safety of our students. To date, we have used approximately $850,000 of the institutional funds to pay down outstanding balances on over 500 student accounts. These payments allowed students to continue with their studies and in some cases graduate from NIU. We have also leveraged the relief funding to offset the costs of our surveillance testing before the SHIELD program went live, as well as enact a wastewater testing program. For students who have tested positive, NIU has paid for off-campus arrangements, both housing and food, for students who needed to be quarantined or isolated. We have invested heavily in classrooms, including enhanced cleaning protocols, PPE, air filters, as well as made available larger rooms to accommodate social distancing requirements. We have made investments in technology, including equipment like cameras, new computers, and video capturing. We have invested in new software to support faculty as they've transitioned their curriculum online, as well as offered online proctoring services. We have also made available laptops to faculty, students, and staff to support the hybrid teaching and learning environment. Even with the relief funding received to date and the stability of the allocation of funding received from the state, NIU is working through the financial impacts of the pandemic. The expected financial impact of COVID-19 to NIU, net of those federal relief funding dollars, is a loss of approximately $28 million. In addition to the increased cost to support the health and safety needs and transition to remote learning, NIU has sustained substantial losses in revenue from our auxiliary services sources, just simply because there's less density on campus. Canceled events such as conferences and athletics, disruption of food service, lower occupancy in dorms and other facilities, cancellation of use of campus venues by other organizations, and lost parking revenue have contributed to financial losses during the last 2 years. We expect these losses to continue in fiscal year 22, even as we eagerly invite students, faculty, and staff to return to campus. I'll turn it over to Provost Ingram to discuss the support offered to students.
Thank you, Sarah. Good afternoon. My name is Beth Ingram, and I serve as Executive Vice President and Provost. Thank you for the opportunity to briefly summarize our efforts at NIU in support of our students. We are committed to making sure that every student succeeds and achieves their academic and professional goals. And we know that we must work differently this fall to make sure that we are committed, that we meet that commitment. We are so thankful for the funding that we've received and are proud of how we've used that funding to meet our mission. We've leveraged funding from state and federal sources to address a range of needs, as CFO Shania has explained. I want to outline here briefly a few of the other forms of support we have expanded or established. On the technology side, as Sarah mentioned, many of our students did not have reliable Wi-Fi, so we provided internet grants to students so they could purchase service. We created a laptop lending program and equipped the library with over 400 laptops that are available as loaners both last spring and this fall. We've upgraded technology in our classrooms to support student learning in whatever modality is appropriate to the class. In terms of academics, we know that students lost ground last year in critical subjects, so we will be offering expanded tutoring and peer mentoring services. We will focus in particular on math skills. These tutoring and mentoring positions also support the employment needs of our students, providing on-campus jobs to our current undergraduate students. Our students, along with our faculty and staff, are likely to show behaviors associated with trauma, so we will leverage the expertise of our College of Education to provide resources and workshops on trauma-informed teaching practices. We will make similar workshops available to staff who interact with our students on a frontline basis. We are developing more resources and hiring more staff in our counseling center and exploring staffing models that will support the mental health needs of our diverse student body as we return to fall semester. Of course, a lot more is going on at NIU, and these are just a few examples of how we've assessed and continue to assess student need and leverage support to respond to that need with a resolute spotlight on ensuring the academic and career success of our students. This concludes NIU's testimony, and we'd be happy to answer any questions.
Thank you. I'm just kind of scanning the list, and I'm not seeing anyone seeking recognition. Thank you for sharing with us and for keeping it brief. We all appreciate that.
Thank you.
I don't know if any of my colleagues want one last chance for any questions or statements. Well, I personally want to thank all the institutions. I really appreciate the time and energy that has put in and thought that has gone into planning for your own institution, taking into account, your individual institution's mission and your geography and all of that factors into that. I appreciate the listening to the experts, the folks that have dedicated their lives to studying infectious diseases, and just the emphasis on keeping our students and our faculty and our surrounding areas safe and healthy. I'll turn it over to Chairman Ford.
Thank you, Laura Stewart. Let me just congratulate you all the universities for your hard work and your passion for getting it right and doing the best that you can in a uncertain type of health challenge that we're all in. And I want to wish you all the very best school year. It's going to be a challenge, but I think that we will get there, especially having a plan. And I think that you have great partners when you work with the Department of Public Health and the the Illinois Board of Higher Ed. So I wish you all the very best school year, and the Higher Ed Appropriations Committee will I guess we don't need to recess, do we? We could just adjourn at the call of the chair, and I think I'll kick it to Representative Stewart for her adjournment.
Yeah, we'll also adjourn the House Higher Education Committee. Thank you, everyone, for your time.
Thank you. Bye-bye.